You all to our two-day healthcare leadership development case competition. And this is ACHE of South Florida's first case competition, which is completely being held on a virtual platform. And we're really, really excited for our students to present to the case. The students have diligently prepared over the past 3 months for today's presentations. And so we're looking forward for them to display their talent during this two-day event. Now, at this time, I'd like to introduce Kenneth Wong, or ACHE of South Florida 2021 president. Kenneth has dedicated many years to the success of ACHE of South Florida and is continuing his service to the organization through his role as this year's president. Kenneth, over to you.
Thank you very much, Ayana. Good morning, everybody. Thanks for joining us on a beautiful Friday morning here in South Florida. We're very grateful for your support. Grateful for the students who spent a lot of time preparing for this morning. Grateful for the volunteering on behalf of our judges and everybody that's here this morning. So thank you. If you give me just a second, I'm going to share my screen with a few quick slides and acknowledgements. I get a thumbs up that you can see my screen. Excellent. Thank you all. Much of what we do throughout the year is sponsored, of course, or funded by our sponsors. And I want to take a moment and recognize all of those that help support our chapter financially, starting with our exclusive platinum sponsor this year, Nova Southeastern University's Complex Health Systems Graduate Program. I'd also like to recognize our gold sponsors, which include Vitas Healthcare, Barry University, D-Signage, Jackson Health System, J-Care, Hill-Rom, Mednax, Amarant Memorial Healthcare System, and the University of Miami. We're also, of course, grateful for the financial support of our silver and bronze sponsors, as well as our media partners and supporters. I know we have many sponsors that are participating in the case competition both today and tomorrow, so thank you all. And we always appreciate it. If you're not members of ACHE or you don't receive our communications, I encourage you to do so. Last year, we gave away about $15,000 in financial support and scholarships. And I don't know if a lot of people knew about that. So if you don't know, you can't compete and you can't put your name into the hat for the running. So I encourage you, sign up for our emails, join the chapter, visit our website. You can see the URL there. It's acheofsouthflorida.org. If you currently don't receive any of our communications, you can text ACHE SFL to 22828. And then lastly, I'd like to encourage you to follow us on LinkedIn. Please like and comment, but please, I encourage you all to take advantage of all of the great things that the chapter has to offer. I also understand that I'm glad you guys made it this morning, but some schools' filters may not allow for our emails to make it through. So if you do sign up, I'd encourage you to sign up using your personal email. Just to avoid any potential issues. And we're going to try to work with some of your directors and your IT departments to make sure we get on your safe lists. For those of you that are not members and are interested in joining ACHE, there is a student associate membership for $75 a year. And if you're interested in learning more, you can go to ache.org/students. and learn about all of the amazing resources that ACHE National offers in addition to what we offer at a local level. I want to, of course, take a moment. Oh, before I did that, I do want to launch a poll, quick 2-question poll, because I know you guys all want to know who won today's case competition as soon as possible. So we're trying to determine what date would work best. So if all of you are in front of your computers, if I can ask for you to answer one of 2 questions. The first one being, would you be available on Tuesday, April 27th during lunchtime, so from 12 p.m. to 1 p.m. for the case competition awards ceremony? And these results will be compiled with the responses that we get from the graduate teams tomorrow. And then Ayanna will be back in touch with a date and an invitation and the logistics for us to regroup so that we can announce the winners. So it looks like everybody sees the results. So we are at an even tie here for this. Okay. I'm going to end, and there should be another question here. And I'm curious, since this may be the tiebreaker, let's see how this goes. Would the evening of that same day work out better for all of you from 6 to 7:30? Okay. All right. Well, it looks like we have a clear winner with this one. Okay. So assuming we don't get any huge contrary responses tomorrow from the participants, then as of now, we will tentatively, and I ask for you to tentatively pencil in 6 to 7:30 on Tuesday, April 27th for the awards ceremony, and we'll follow up and be back in touch. Thank you all for the responses. Okay. So lastly, of course, I do want to take a moment to acknowledge and recognize all of the hard work that goes into planning today, tomorrow, and everything leading up to it, which is, I'm sure as you can imagine, a lot. Ayanna Miller, as you heard her mention earlier, is the chair for this year's Student Services Committee. Ayanna has been a member of ACHE since 2005. She became a fellow in 2008, and she's been an active member of ACHE of South Florida, serving as the 2019 member at large. In 2020, she was a Student Services Chair-elect, and then, of course, this year is the Student Services Chair. Ayanna is dedicated to the mission and vision of ACHE of South Florida and takes pride in being a part of an organization that fosters continuing education, networking, and career development to its student members. Thank you very much for everything that you've done to get us to this point, Ayanna, and then beyond, because I know it's not done just yet. And I also want to take a moment and introduce and acknowledge Marla Sanfilippo, who is the chair-elect for this year. Next year, Marla will be taking over Ayanna's role. And Marla Sanfilippo has been in healthcare for 20 plus years and has worked with both for-profit and worked for both profit and nonprofit hospitals and healthcare systems. Marla has had various roles in healthcare leadership positions in the private and public sectors, currently Vice President of Operations at Community Psychiatry. So Marla, thank you for everything that you have done to contribute to get us to where we are today and to the finish line with this. So on that note, thank you all very much for your time and attendance and support again, and I will turn it back over to you, Ayanna.
Okay, thank you so much, Kenneth. Marla, I'd like to go ahead and turn it over to you. As Kenneth had indicated, Marla is the ACHE of South Florida 2021 Student Service Chair-elect. And Marla is going to go ahead and highlight some of the benefits of the Student Service Committee and then also the Student Service Chapter for ACHE of South Florida. Marla, over to you.
Sure. Good morning, everyone. ACHE of South Florida is dedicated to serving the student members in pursuit of their professional development in both healthcare management and administration. And we provide a lot of opportunities for networking and help with other healthcare professionals throughout kind of the whole market here in the region of South Florida. A few of the benefits that they offer: they have an employment service center, which they have a job center and a resume bank. They also have an opportunity for you to have your resume critiqued by a leadership or someone in leadership and give you guidance on your resume. A lot of those networking, it is that, how I say, the 6 degrees of separation, where you end up meeting people that either know people. I mean, a lot of times when I get jobs, I will refer them on to my colleagues at ACHE in the chapter because I know of somebody that's looking. So frequently when we're even in our networking, even the Zoom networking this year, I'll ask people, hey, if you're looking, or what are you looking for? Or if I come across anything, I'll let you know. So we do a lot of that and try and foster people within the organization to help connect you with them and get it, get in touch with them to potentially have a career opportunity with that organization. There's lots of publications and newsletters that are also resources to you through the Student Services membership. So those are all positive things, as Kenneth already mentioned. We also have scholarship programs. We also have fellowships and residency programs and lists of those that you can apply for beyond your years of service as your education continues or winds up. So lots of opportunity available through the chapter and through ACHE. So we do encourage you to join. As Kenneth mentioned, the student membership is $75. And I can tell you it's well worth and then beyond the $75, and hope that you'll continue to become a member within the organization. We have lots of opportunities for you to participate in activities around various markets of healthcare. And I say that because it's not only just hospitals that are people that are memberships here with the organization. It goes well beyond that. You have people that touch various aspects of healthcare, and that's the nice thing that's so diverse about ACHE is, yes, you may meet people in hospitals, and that's great, but you'll have different sectors of people that might be in physical therapy, outpatient rehab, outpatient practices. It just varies. I've even met people that do construction, like construction and development around healthcare, and they're totally focused on architectural healthcare. So I say that because it really runs the gamut of people that you will meet and come in contact and have opportunities within healthcare, technology sectors of healthcare. We do talks on security in healthcare. So it's such a broad band for you to jump in and really meet a great diverse group of people and network with a great diverse group of people to provide different opportunities in healthcare. Thank you.
Thank you, Marla. I'm going to go ahead and just share my screen. Okay. So at this time, I'd like to recognize the program directors for fostering the students' interest in the case competition and also encouraging their students to participate. From Barry University, we have Dr. Jeffrey Ritter. From Florida Atlantic University, Dr. Alan Whiteman. From Florida Atlantic University, Dr. Jennifer Atenito. For Florida International University, Dr. Tina Young. And from Florida International University, Dr. Michelle Kamika. From KEISER University, Dr. Nina Del Reyes. And from University of Miami, Dr. Caroline Mortensen. Thank you, program directors. Now, I'd also like to give a special thanks to the Student Service Committee for all of the time and effort devoted to the organization of this event. As Kenneth had mentioned, this was, over the span of at least 3 or 4 months. And I really appreciate all of the time and effort that the Student Service Committee has put into this event. So Kenneth, Bookie, Marla, and then of course, Adrian as well, who helped quite a bit. I'd also like to thank the mentors who shared their knowledge, skill, and expertise to guide the students through the preparation for the case competition. We really appreciate that you've taken the time out of your busy work schedules to help the students, put together their presentations and executive summaries. So thank you for that. Next, I'd like to go ahead and introduce our judges. We have an impressive panel of judges that have extensive telehealth and healthcare leadership experience. Our first judge is Dr. Michelle Thompson. Dr. Michelle Thompson earned her medical degree at Mount Sinai School of Medicine in New York in 1997. She completed her residency in internal medicine and fellowship in geriatrics at Montefiore Medical Center. After her training, she practiced as a geriatrician at Sarah Newman Center for Healthcare and Rehabilitation. Dr. Thompson then launched her geriatric private practice, Geriatric Medical Service, in 2004, caring for patients in various settings, including nursing homes, rehabilitation centers, and hospitals. In 2011, Holy Cross Hospital in Fort Lauderdale recruited Dr. Thompson as medical director to create and build their palliative medicine service. After devoting 6 years to building a successful hospital-based palliative medicine practice, she accepted a new challenge at Vitas Healthcare as associate medical director. At Vitas Healthcare, she provided medical help for physician direction and oversight to assure the maintenance of quality standards of care for patients and families in one of the fastest growing programs in the nation. Currently, Dr. Thompson is the owner and medical director of Epic Medical, a telehealth functional medicine practice that aims to help patients understand why their body develops dysfunction and address the root cause of their illness. Dr. Thompson, thank you and welcome.
Thank you. Thank you for having me.
Our next judge is Dr. David Mishkin. Dr. Mishkin is a board-certified emergency medicine physician who joined the medical staff at Baptist Hospital Emergency Department in 2010. Dr. Mishkin has always had a keen interest in healthcare innovation and enjoys the applicability of the advances of medical technology to better support his clinical practice. Over the past several years, he has focused his efforts on integrating telehealth as a means to enhance the patient experience by providing an accessible and affordable alternative to traditional healthcare delivery. As medical director of Care on Demand, he can align this passion while honoring his commitment to best serve both his patients and the South Florida community at large. Dr. Mishkin is an active member of the American Telemedicine Association and is actively engaged as both a speaker and clinical advisor throughout the telehealth industry. In addition, his telehealth medicine practice, he also serves as the assistant medical director at Baptist Hospital Emergency Department. Thank you and welcome, Dr. Mishkin. Our third judge is Mr. William Manzi. Mr. Manzi is the Administrative Director of Telehealth Strategy for the Memorial Healthcare System and a past member of Florida Governor Rick Scott's Telehealth Advisory Council. For Memorial, he blends strategic vision, strong clinical and technical backgrounds, a profound understanding of finance and operations to implement technology that delivers an improved healthcare experience. Now, William believes in upgrading healthcare by focusing on the triple aim and creating innovative concepts with technology to drive that change. He's been leading the charge in telehealth program strategy since 2011 and sees no end to his passion. Manzi holds a bachelor's degree in information technology and a master's degree in business administration. He began his healthcare career in 1992 and held a variety of positions prior to focusing on telehealth strategy development, performance improvement, and patient satisfaction using telehealth. He has overseen the introduction of Memorial Doc Now, an app that provides 24/7 online access to a doctor for non-emergency care, and has implemented several programs to make healthcare more accessible and convenient for the consumer. He recently was showcased on the cover of Healthcare Leaders magazine and has presented as a telehealth subject matter expert in conferences around the country. Thank you and welcome, Bill. Okay, and so now I just wanted to give the audience a little bit of information regarding the case study that the students will be presenting. The name of the case study is Doctor on Demand, and it considers the delivery of services via telecommunication technology. What Doctors on Demand sought to do was to solve 4 main challenges that the telehealth industry faces. So the first one is the patient's knowledge of available telehealth services, the right incentive for payers, the need to add more providers and offer broader range services, and the impact of the regulatory environment. I also wanted to go over the presentation format for today. The teams are utilizing fictitious company names. Each team will be allotted 20 minutes to present their response to the case study. And there will be a 10-minute judges question and answer session, which will precede each presentation. We will also have 5 minutes judges deliberation that will be allotted. And for the duration of the presentation, our audience will be muted. For today's presentations, we have our undergraduate teams that will be presenting. So team 1 is Digital Docs and team 2 is Telecore. I have listed there for tomorrow's dates. Of course, we'd love for everyone on this call to go ahead and join. April 10th, hopefully you all have registered already. If anyone needs to have accessibility to the agenda, it is posted on the ACHE of South Florida website under the Events tab, just in case anyone needs to have that. So at this time, I will go ahead and pass it over to our first team, Team Digital Docs. And I'll also ask for any of the members of Telecore to go ahead and drop off of the call at this point. And then you can join back in a little bit later once it's time for you to present.
Good morning, everyone.
Good morning.
Okay, you can hear us good? Awesome, thank you. Okay. Yeah. Which one do they see? Why isn't this working? Can they see this?
Try going up to slideshow.
Yes.
Up to slideshow?
Yeah.
Right.
Sorry, technical difficulties.
And then play from beginning. There you go.
Can you guys see our presentation?
It's still not presenting as a presentation.
Why is it doing that?
Try
Just
hitting.
click on from the beginning. To the left, yes.
We're clicking it, it's not allowing
That
it.
is not allowing us. What the heck? So sorry, technical difficulties. Can you turn off that screen?
This has happened before.
It's happened before.
Yeah, this is a problem with Zoom.
Okay. So we are just gonna make it like this. I hope that's okay. Oops, so sorry. So this is how we're gonna present, sorry.
Excuse me a sec. Did you guys try down the very bottom to the right of comments? You see the four icons down the very bottom? Yes. Did you try? You did try that?
Yeah.
Okay. All right.
It's not working
Sorry,
either.
just wanted to double
Sorry.
check. Okay.
Sorry about that. This is how we'll do it though, since we have technical difficulties. So good morning, everyone. My name is Cassie Hoover, and this is Gina Stetz and Samaya Sultana, and we are the Digital Docs. And today we will be presenting our ideas on how to better improve the doctor on demand for this case study. So currently in the United States, telehealth has been a great invention, especially during the coronavirus pandemic time. It has helped patients a lot, especially for minor consultations with providers, and has helped cut down on costs on travel time and wait times. However, we believe that with our suggestions today, we can make telehealth platforms for doctor on demand even better. For example, in other countries such as Japan and Canada, they have been utilizing telehealth more than we have in the United States. In Japan, they have developed a nationwide telehealth app where citizens have been using it like social media. Therefore, it is widely used and widely accepted. In Canada, they have been using telehealth and it has been evolving with the times. They have already seen numerous benefits, such as more research being put into telehealth, more products being given to the public, more technological capacity of the platforms themselves, and more offerings by companies to get to know their consumers better.
So in our Doctors on Demand case study, we want to address 4 main things. First, we want to address the scale, so that would be on how can we increase the number of patients that our telehealth platform can accommodate for while still maintaining patient-centered care. Next, regulation, which would be how patients can receive consistent quality care and how we can promise that both patient and the providers are protected legally. Next, we have utilization. That would be include making sure our patients are using telehealth platforms and how they ensure they will continue to use it. Finally, we have our awareness, how we will inform our patients of their different options of care. And finally, how we would ensure the providers are knowledgeable about the use of these telehealth platforms.
For our proposal to improve the telehealth app for Doctor on Demand is going to bring in a simplistic idea from current trends to help patients find providers with ease to make easier appointments. We're going to keep the app simple to narrow down the search so that way they can find the provider that fits them the best. As you can see a picture on the screen, this is what we believe the doctor on demand should look like. You're going to see the picture of the provider so that way they can see the provider. You're also going to see the distance the provider is away from the patient, and then a brief summary about the provider. The patient has the option to either agree to see this provider, disagree, and they also have the option to call the office if they have any additional questions that's not listed on the profile.
So in order to make our telehealth platform a larger scale, our idea was to bring in a regional model with a central headquarters. So the regional model will allow us to get to know our consumers' wants and needs and will allow us to create a user profile from the information provided to us. In our case study, they said that they had issues with out-of-state providers providing care to out-of-state patients. With this regional assignment, doctors will be assigned to patients within their region. Therefore, this will eliminate that extra complication. In addition to our regional model, we still want to have a main headquarters in order to have information centralized and organized for all of the doctor on demand issues. Within this regional model, we want to work with the insurance to improve plans. This would be increasing the number of plans provided, which would include these two separate plans listed. So the membership fee would be more of a subscription fee that patients would use if they're planning to use the telehealth as their main source of care. On the other hand, we also have a fee for service if patients want to keep the telehealth as an option, and they would also pay a copay when receiving this service.
So for regulations and contracts, we believe patients should have to agree to enter a telehealth, knowing that the diagnosis and treatment will be based off the information they provide to their provider. For policy change, for reimbursement, we believe the increasement use of telehealth can affect the reimbursement rates. To do this, we are going to add sponsorships within the app to ensure reimbursements. These sponsorships will come from local businesses to nationwide companies. Here's an example of what the provider and medical assistant will go over before they see the provider themselves. It's going to be a simple design for easy patient access. This is then going to be uploaded to the patient portal app for the patient to have at their fingertips to supply to another provider if needed. For utilization, it's going to be value-based medicine. To do this, we're going to send every patient a survey after their consultations with their providers. It's going to ask them general questions, what they liked, what they disliked about their services, and it'll also give them a suggestion text box for additional information. All of this data will be collected and sent back to our regional branches to ensure quality care.
So for sending it back to our regional branches, the branches will then use it to determine the overall quality that the provider gave to the patient for each individual consultation. This then will be used to determine their reimbursement and will also be sent back to the main headquarters to look at the overall success of our value-based care model. This will incentivize providers to do well, and patients will also be more likely to fill out these surveys if they either had a very good or a very bad experience. This will elicit honest and truthful feedback from our patients.
So for the awareness patients, to increase patient awareness of telehealth, we decided to do partnerships with community needs assessments, which are nonprofit organizations. We also decided a wide variety of care disregarding socioeconomic status. We're also going to do regional model to know patient needs. So in addition to awareness of our patients, we also want to we also want our providers to be aware of as well. So we want to do the telehealth just like we did with Medicare. So we would have specific standards providers must meet in order to get the reimbursements. That would be something from the Department of Health and Human Resources, which is also like the HITECH Act, which was used for the electronic health records. We also want this to be volume-based, more like if the providers see more patients, they would benefit from it. So that way we would increase patients. They will be seeing more telehealth patients that would give more beneficial to the providers.
So with including all of this, we also want to look at the cost control. So as given in our case study was this chart where we can already see that telemedicine and telehealth is much less expensive than other traditional options. In addition to this, we also want to place time limits on these consultations, and this would only include the one-on-one time with the providers and not the information gotten during the medical assistance. This will help us to meet our goals of both quality and volume-based care by using research to figure out an optimal start time, and then using our surveys to figure out a more typical time for the Doctor on Demand platform itself. We also want to work with our insurance, as I stated before, for more expensive options during this process. This would be including vital home kits where patients can take their own vitals to provide to the providers during these consultations. By having this with the insurance, this will increase the appeal for patients to choose that insurance plan, and therefore will increase the number of patients and the volume of people on insurance. Another way that we plan on cost controlling is through using Oscar Health Insurance, where their motto is simple, smart, intuitive, and friendly health insurance. This will be our foundation of the telehealth platform, as they will keep track of all personal history to use predictive analytics to figure out the best insurance plan for the individual. By being able to see the recommendations given to the individual, they are able to choose which plan that they would like the best, and will cut down on unnecessary costs for providing different insurances to people that don't need it. Oscar Health Insurance is also a B corporation, meaning that they give back to charities. This will increase our appeal to sponsors as they balance both purpose and profit and do business for bettering the community.
We also believe within the app, they should have icons to help patients and providers. So to do that, we believe that the help desk will allow the patient to ask for help on how to either set up an appointment or any further questions. Like stated back in cost control, we believe the at-home vital kits should be able to be requested through the app through their insurance. For the ones with hearing issues, there is captioned video, so that way they're able to talk with their providers back and forth. And then also they're able to make up follow-up appointments for either in office or another telehealth.
So in conclusion, the digital docs will help Doctor on Demand by assessing information from other countries to address the scale, utilization, regulation, and awareness of the Doctor on Demand platform. We have created a very user-friendly app and will provide a regional model with a central headquarters to assess our surveys given to patients after consultations. We will include both HIPAA and malpractice in our platform, and will utilize value-based medicine to ensure patients are receiving good quality care over telehealth. We will also create partnerships with our community needs assessments, nonprofit organizations, and receive sponsorships from both local and nationwide companies. This will all be done to cost control and provide patients with good quality care. We look forward to the questions that you have for us, and thank you for listening to our presentation.
Thank you.
Thank you.
Okay, thank you, Team Digital Docs. So at this point, we'll go ahead and move into our judges' question and answer. So Dr. Thompson, Dr. Mishkin, and Mr. Manzi, we'll go ahead and pass it over to you for questions to the team.
I'll go first if that's okay. How does your model address the socioeconomically disadvantaged community? How do you reach to that community?
Yeah, that one right here.
So we want to work with the insurance in order to get our platform outreach to as many people as possible. So not only do we want to increase our care for the patients that already have the technology, but we want to address the people within those lower income disadvantaged as well. So we want to work with our insurance more, or work with Medicare and Medicaid to get to those populations.
Another form of it can be Project Access. They are ones to help ones that are in need of care and can't find the proper physician that will see them. So certain physicians will take this as a form of insurance to see the patient, and then it's then sent to Project Access for them to cover the care of cost.
Dr. Michigan. Okay. You're on mute, Dr. Michigan.
Sorry, my bad. Good job, digital docs. My question is, can you guys elaborate more on why it's important to develop a regional model with connecting providers to their patients for your model?
So we really want to do a regional model just so that the providers and the patients get to know each other on a more intimate level. So if we have the patient going to a different provider every single time, they're not really going to understand their feedback. They'll just understand what is already on their health record. So we really want our patients and providers to get to know each other a little bit better. Even if it is just a regional model, like a few states with each other, this will really help the providers and the patients to get to know each other, to understand what the patients want and what the patients need from this telehealth platform.
So, excuse me, on one of your, I think it was your first or second slide, you mentioned why telehealth is good. You listed it as telehealth is good for, and you had all these reasons. You left out one of the most important reasons, which is accessibility. And I'm curious as to why you didn't have that there, or are you not focusing on providing access to patients?
Okay, so we wanted to save that for a little bit later in the PowerPoint, just because it is so important. So we completely agree with you. We thought it was so important that it needed its own extra slide. So we didn't want to be redundant in that slide, and we wanted to address it as a whole nother issue.
Okay. I must have missed it then because I didn't see it in a separate slide. My apologies.
No, you're good. That was the awareness for the patients and the accessibility through getting to know your providers, and that we were working with the different partnerships for the community needs assessments. And what was the other one? It was the insurance companies.
Okay, and just one more, piggybacking off of what Dr. Mishkin mentioned, having a centralized model, how would you ensure that the regional physicians are following the same procedures and policies that you set in place so that the care plans are consistent throughout?
So what we decided to do for, so we still, like telehealth won't be just like the main platform for patients, because sometimes you do need to see patients in person, because you can see through, like, you know, when you do FaceTime or however you want to do it. So like doctor would decide if the patient need to see like in person, just to do like, for example, if you have some rashes, you might not be able to see the color. It might show like different color, and you won't be able to diagnose just through camera or however you want to do it. So that would be more like the provider and the patient. So they would decide if they need further evaluation. So they could see the patient in person later on. So telehealth, it's our main goal, but still we want to give them the best care possible, and definitely providers want to give the best care to their patients as well. They want to misdiagnose or anything like that. So that would be more like in-person plus telehealth. So they would have the option to choose from there. Once it's telehealth, they will do telehealth, but doctor will decide if they need to see in person as well, just to give the best care.
I have a question. You guys were talking about, really trying to impact affordability, and one of the things you guys mentioned was sponsorships. In regard to your sponsorships, how are you going to balance the sponsorship component with the patient sort of privacy component with healthcare, since it's a very personalized experience?
So the sponsorships are not going to see the patient's information. The sponsorships are going to push out the Teleform platform. So basically what we were trying to get by with sponsorships, kind of like how when you started off your guys' presentations, you're like, oh, we want to thank the sponsorships of the gold, the platinum, the silver. So we're going to implement that into the app. So we might have a sponsored by, and then it will say the company's name on the telehealth app, and they're sponsoring the app itself for then the reimbursement for the providers. But the sponsorships will not know for patient confidentiality of who they are seeing and what the patient is diagnosed or anything like that. They won't see any of their information due to HIPAA.
Okay, great. Thank you.
Can you better define value-based care when you incentivize physicians with a volume-based model that may compromise quality of care if physicians are being driven by volume for compensation?
So it's not just like, for example, when we see patients, like I worked as medical assistant as well. So what we do, like when telehealth, you would still see patients, like if you're not do like follow-up, you already seen the patients. So you don't need them to come in person to diagnose again. So you could just get it over with telehealth because you were just giving them the information, what they have and what should be done in the future appointments. So that's what we focused on.
So we also, we wanted to do both value-based and volume-based. So with our regional model, that will help us to address the value of our care. So that's how we're going to do our surveys. So that's how we're going to ensure that the patients are getting good quality care. And then we're also going to mandate that the providers themselves become knowledgeable. So maybe we could do like a continuing education credit for those providers that are on our telehealth platform in order for them to get to know the platform and get to know how to work with patients through telehealth even better. And then for the volume-based, we really want this to be scaled to a larger model. So we want to keep that quality while having more patients and more providers on the platform itself.
You guys mentioned about utilizing vital home kits, which kind of goes into a little bit in the area of developing better data for your patients, but also maybe some remote patient monitoring, which is a whole other topic. When you guys introduce that, are you guys looking at that from more of a revenue generate more revenue, or looking at it from a quality perspective, or both?
There you go. It's more from a quality perspective. We believe, so let me go on why we chose that for the vital kit. So my grandmother has health issues and her insurance just sent her a vital kit. It has a watch where it takes her steps of how many steps she's taking. It also takes her blood pressure, and it also keeps track of her heart rate. And all of that is stored into a cloud and then uploaded to her provider's system, so that way they can review her work without her coming in through telehealth medicine. It also came with other vital things that she needs, where it has like a blood cuff. It also came with like little old people socks so she doesn't slip and fall. So it was just very essential things that she needs through telehealth to see her provider without having to drive such a far distance. She lives up north. She can't drive in the snow. So it's something that was very beneficial to her to use during the pandemic. And it's something that she's going to continue long term. So that's something that we believe that telehealth should implement, especially for the elderly population.
So I know we're rounding out the last few questions, Ayana, sorry. With all the information you shared, and it was a great presentation, let me start my question by saying that it sounds like you guys really did your research and got a lot of great information. I'm curious to know, are you looking to focus in one particular area with this app? Because you are mentioning the 24/7 urgent care, you are mentioning chronic conditions, the app being used for regional physicians with their patients. And just a few minutes ago, you mentioned chronic conditions and monitoring of those conditions. That's a lot of different areas, and it doesn't sound like this app would be a master of, it can't be a master of all. Have you given some thought as to where your focus would be with this app? And then my last question is, have you guys, has anyone on the team experienced a telehealth visit yet?
Can you repeat that last part?
Has anyone from your team gone through a true telehealth visit?
Yes, I have.
You have to go ahead.
Yeah, you can talk on your experience.
So yes, so I do have experience. So when that was my follow-up. So I had like, she just went over my reports, like what I should be doing in the future and all that. So there's like visits that we don't need to see doctors after procedures. And for example, if someone is like living on like out of state or anything like that, but they still want to see the same doctor, and it's not possible for them to see like, you know, a difference, like they won't be able to make it. But when the telehealth is going to help them to see the same provider they prefer, and that would help them, and that would be more of, you know, so you don't need those visits in person because you can get done a lot through telehealth. And that would actually give patients more opportunities to see the same providers.
And it would also help the providers for time quality as well. You would have time to still see patients in office, and then also make time to see your telehealth patients as a follow-up. So like you were saying, you don't think it could be such a wide-based platform where you can see different forms of medicine through the app. But if you're using it as a follow-up, it's something that's going to be very vital to, I think, different offices, especially if the providers are very busy. They're able to see patients on their own time and still give that quality care to the patient.
Thank you. That's just the notification on time. Digital docs, thank you very much. That was a great presentation. Judges, thank you for those questions. Awesome questions. At this time, I'm going to ask digital docs to go ahead and drop off of the Zoom. The judges are going to move on over into deliberations, and then Team Telecore will go ahead and set up for their presentation.
Okay, thank you so much. We really enjoyed all of your questions, and we look forward to hearing from you soon.
Thank you.
Bye. Thank you.
Excellent job.
Thank you.
Okay, so while Kenneth is going ahead and moving the judges over into the breakout room, I'm just going to go ahead and share my screen. So I just wanted to share ACHE video overview. So basically what this video is was shown at the 2018 past Congress of Healthcare Leadership. And it really outlines the ACHE strategic plan and details.
All right, great. We're waiting for one more.
was taught to just figure things out. So when I was given a doll that talked, I cut it open to find out how. But when an accident sent me to the ED, I wasn't curious. I was scared. And then I met a true caregiver, Emily.
It's clear to me now that my mother did not get the care that she needed. If she had, she might be alive today. Healthcare is so complex.
People in this community had nowhere to go when they were ill or hurt, so they built this hospital.
I was a young woman with a little money and a big dream to make the world a healthier place. Where did my dream start? In the mailroom at a hospital.
The job of leadership is bigger and more challenging than ever. ACHE can help you achieve your personal best while making healthcare safer, more accessible, and more affordable to all. Together, we are meeting today's challenges with bold new solutions. As a catalyst, ACHE is advancing patient safety and identifying and delivering solutions to transform health.
I was blessed by two mentors. My father, who cared so much about me, and Emily, who cared for me so well. My approach to life has always been simple. Accept and excel at every challenge, every opportunity.
Healthcare leadership is a big responsibility, and it's one I take personally.
But we're human. Sometimes we make mistakes when we're trying to heal. So we commit to change, to lead the way to better care.
We are leading together. ACHE serves as a connector of people and ideas to transform care. Advancing equity, quality, and efficiency in health calls for fresh insights, diverse perspectives, and collaboration. You belong to a strong network of 48,000 leaders, nationally and locally through chapters. Dedicated colleagues from a variety of settings, prepared to share, transcending roles, disciplines, and career stages, always for the common good. We are listening to you and responding with new, convenient, effective ways to learn. And we're personalizing your journey so you can chart your development every step of the way.
Now I'm in a position to help people get the care they need.
But I wasn't born a leader. Leadership comes with time. Time spent learning with others and serving others.
Our community made a commitment to provide access to better care. Today, I'm leading that commitment.
I can face the challenges. I just can't do it alone. We're all on this journey together. Different paths, same goal.
Leadership is demanding. You need to take care of yourself and those you lead. Our work to strengthen excellence in healthcare management is magnified by the support of our premier corporate partners and extends across the continuum of care. With our allies, we are able to offer tailored resources and tools so you can serve the profession with mastery. And thanks to generous donors, the Fund for Healthcare Leadership's member-driven support provides scholarships to help future leaders receive the education they need. Through every stage of your career, ACHE is your trusted partner, helping you advance and improve the health of your communities. We are all driven by the same values.
Leadership,
Integrity, lifelong learning,
Diversity and inclusion.
improving
Health.
What can be bigger than that?
Okay, I hope you guys enjoyed that video. We could probably give the judges a couple more minutes to come back into the room and then allow for Team Telecore to go ahead and proceed with their presentation. So we'll wait a couple of minutes for the judges to come back into the room.
We're back.
Okay,
wow.
welcome back, judges.
4th century.
Okay, and so it looks as though we have all of the members of Team Telecore on. Is that correct? Yes, thumbs up. Okay, so I'll go ahead and pass it off to your team. You can go ahead and start with your presentation.
Alrighty, thanks for sharing, Bashara. One sec. Okay, so hello all and welcome to Telecore's Comprehensive Plan for Success regarding Doctors on Demand. First, we would like to thank you so much for being with us here today, albeit virtually. This was a great opportunity for us to work together as a team and bring you something that we're proud of. My name is Sedona Rose Webb, and I will be presenting alongside Christina Jairaj and Rashad Malhotra. And our other team members, equally important, Bashara Randolph and Julia Platt, will be in the audience. Okay, let's get to it. So we first wanted to give you some brief background on the case and Doctors on Demand in general, a little more in depth than we had in the beginning. So Doctors on Demand was founded by famed teledoctor, Dr. Phil, and his son, Adam Jackson, and they had a simple goal in mind: to deliver better medical care at a lower cost. And what better way to do that than with today's technology? And so Doctors on Demand aimed for these promises. Number one, 24/7 accessibility to a doctor. All of which would be number two, board certified or licensed to provide you a quality standard of care. Not only that, but number three, you wouldn't have to worry about insurance, which would be accepted but not required and could be compensated for with a non-prohibitive fee for service. And further, four, if you didn't need a doctor on demand, you could schedule an appointment through the platform at your earliest convenience. So this case showed us that Doctors on Demand is ready and able to separate itself from the competition, and growth can only go up from here if we acknowledge and overcome the challenges. Next slide. Okay. So the greatest overarching challenge in telemedicine is that decision makers still do not have good enough information comparing the effects of telemedicine applications to alternative care strategies. And tech barriers like broad bandwidth and regulation, compliance security measures have precluded growth in the past. Beyond that, challenges specific to Doctors on Demand are fourfold, with the first being regulation. So especially before the COVID-19 pandemic, laws and restrictions were confusing and multidimensional. They varied from state to state. However, during the COVID-19 pandemic, many regulations were rolled back to allow for what we now know as essential telehealth services, and we need to keep it this way. Another issue was utilization, which is calculated by the number of visits in 12 months divided by the number of eligible visits in 12 months. And although we were leading in these rates at 10% in 2018, that is still definitely not enough when the industry as a whole only saw around 2.5% utilization. Of course, these numbers have grown during the pandemic, but there are huge gaps in utilization rates varying amongst demographics and regions. And the biggest cause of that seems to be lack of awareness, which is number three. Lower awareness leads to lower utilization rates, and so we need to continuously enhance our services and advertise them to partners, payers, providers, and patients to drive up utilization, awareness, and then scale, which is the last issue. By scaling up, we intend to expand integrated services to our consumer base through things like mergers and acquisitions, which my teammates will talk about later. So those are the challenges, but increasing accessibility to care at a lower cost will be worth it in the long run. And we'd like to display that through the shared value perspective of the quadruple aim. So we know the goal of Doctor on Demand is to deliver better medical care to more people for a lower cost, but we can align our goals with the quadruple aim framework approach to population health, which is achieving better outcomes, lowering costs, improving the experience for both providers and patients. If we do that, we can also drive Doctor on Demand to be a more profitable business and enhance the consumer's perception of quality. So how will we work with the quadruple aim framework? By aligning goals and incentives. Next slide. What does Doctor on Demand want? To increase utilization. And to do that, we have to convince people that telehealth is the best for them. We also want to expand our market share, which we can do by increasing awareness and utilization of services. And last, increased profitability will come up when we show the payer, provider, and patient that Doctors on Demand is right for them. So we can incentivize payers with cost and time efficiency that telehealth provides, which can then allow really larger payers to expand and meet the needs for more vulnerable and underserved populations, which is a direction that the healthcare industry needs to lead in. We can also incentivize doctors with the time-saving aspect and providers, where they will get to see more patients and waste less time. This will make patient management easier since the information that they need for each patient will be saved within their profile. And last, it will give providers an opportunity to increase their income if they work for Doctors on Demand outside of their usual and perhaps in-person job. And our biggest concern, the patient, the consumer, will also be an advantage using Doctors on Demand services, for they will have greater access to care 24/7, no strings attached, at a lower cost that is non-prohibitive, even for people without insurance. It will also provide a sustained quality of care for people with maladies like chronic disease who have to see a doctor really often, but may not be able to make the journey. Which leads me to the last aspect of telehealth that is honestly a goal for everyone, especially in the United States, which is convenience. So no driving, no waiting, no piles of intake forms, just you and your doctor. And now that you know our goals and mentality and the challenges we all face, I'll have my teammates guide you through our solutions.
Thank you, Rose. So now I'm going to talk a little bit about what has been going on over the COVID-19 pandemic and how it's kind of acted as a big push for the telehealth market. So first of all, I just wanted to touch on the President Trump's CARES Act. So essentially what that is it's a plan about $400 billion to expand access to home or community-based care. And essentially one of the biggest components of it was accepting or Doctor on Demand being able to accept Medicare Part B, which is a huge expansion for the industry. The next part is President Biden's infrastructure bill. A lot of people, when they look at this, they say, how is it related to telehealth? How is it going to expand telehealth technology and the access to it? Well, telecommunications is a big component of the infrastructure bill, and that focuses on increasing broadband access, increasing bandwidth capability, and just overall increasing the access for some people who may not have the technological capabilities to use telehealth technology. And overall, what this is doing is these plans are expanding the telehealth market by increasing awareness for services and then therefore just increasing utilization rates. And with this comes along a need for lobbying, which I'm going to touch up more on in the next slide. But as this demand increases in the telehealth market exponentially, we're seeing a need to keep up to date on regulations and policies as well. So now I'm going to talk a little bit about our regulatory and lobbying team. So we split it up into two components. The first being the lobbyists. Essentially what they're doing is they're creating productive relationships with different stakeholders that we're trying to appease to. So Rose went over them. They're people like employers, insurance companies, health systems, providers, and obviously patients, but being able to keep them satisfied and just keep up to date with them just so that we can support a rapid transition to expanding our telehealth offerings. We also or like an example of that would essentially be the American Medical Association being able to encourage more lax laws just so that we can allow the telehealth market to flourish more. The second component is a regulatory compliance team. Essentially, what this does is in the environment that we're in with telehealth, things are constantly changing from a regulatory perspective and a regulatory level. And the telehealth industry is very dependent on that. So as regulations change from a state and a federal level, being able to quickly adapt to those regulations and being able to, pick them up when they happen is something that is essential for a telehealth company because it impacts your business model, your revenue model, basically the whole company's bottom line. And keeping that in place, keeping that as a team that is always constantly on top of things and staying updated on a daily basis is something that's just essential for any company operating in the telehealth space.
All right, as we previously mentioned, in the face of this pandemic, there has been a really exciting push towards more telemedicine. And in light of this, a few of the main objectives that Doctor on Demand now has is providing evidence of tangible gains in population health outcomes and also differentiating itself from its competition. That's why Telecor's recommendation is to expand the market share of doctor on demand through the provision of home healthcare kits. These proposed healthcare kits will include cutting-edge medical devices such as TytoCare and other smartphone adjunct devices that will allow for a more comprehensive view of the patients. And they will allow for highly accurate diagnostic testing and specialized treatment plans. These kits will allow Doctor on Demand to scale its services to include those that require checking vitals, viewing bodily or epidermal injury, and monitoring other health factors associated with chronic diseases, with a decrease in misdiagnoses and poor health outcomes. By adding these services, Doctor on Demand can increase its copays by including new specialty visits, such as dermatology appointments, and this will increase the profit to cover the expenses of these home healthcare kits. The provision of these medical equipment that allows for monitoring of chronic diseases will also increase elderly patient utilization and chronic disease equipment utilization. This will further increase return on investments as these patients are more likely to have insurance, whether it's through Medicare or Medicaid, and will tend to seek regular appointments. Not only does Doctor on Demand benefit financially from this investment, insurance providers will as well, since the unmonitored chronic diseases and elderly patients could have larger health outcomes that have worse outcomes in the future. The next proposal that we have is direct patient to lab testing, which will allow members to have unprecedented access to the large array of tests that can allow for general diagnoses, such as with identification of allergens, to more sensitive issues such as STD testing. This initiative will allow Doctor on Demand to reach a wide variety of patients, specifically those who are homebound and live in rural areas with inadequate access to healthcare. Additionally, this investment with Doctor on Demand provides a differentiated service model from competitors, and this creates a perfect marketing and awareness strategy for increasing awareness in our desired patient populations. Furthermore, investment in home healthcare kits and laboratory deals for Doctor on Demand patients will allow Doctor on Demand to scale its healthcare services into new specialties in a manner that will promote high returns while also increasing access to vulnerable populations and decreasing costs to patients and all payers. This will allow us to provide a defense to limit inhibitive regulation of healthcare services with telehealth. Next slide. Telecor's next recommendation is expansion of the Community Navigators program. By hiring registered nurses, trained healthcare professionals, or other internet technicians, these community navigators will ensure that patients are maintaining their virtual visits and following through with treatment programs. There will be an increased encouragement to comply with medical recommendations and multiple opportunities for patients to ask their questions. This will allow them to take a greater stake in their personal care. In addition, community navigators will provide technology assistance by offering support through multiple modalities, whether it's in person or over the phone, to allow vulnerable populations and patients that are unfamiliar with technology to utilize Doctor on Demand services and become more comfortable with virtual care. Additionally, through a system similar to HIPAA compliance and with the electronic health record, community navigators will act as a reminder service with a personal touch, encouraging and reminding patients to keep up with their regular appointments and comply with medical advice, whether it's reminding patients to take their pills during the day, lower their sodium intake, or just regularly checking their blood pressure. And this will allow us to track vital and outcomes when necessary. And then with this data, without identification and in accordance with HIPAA, patients will be more likely to trust Doctor on Demand because we will be able to show tangible and marked improvements in patient outcomes. Furthermore, this data will be sent to our regulatory compliance team, and we will also be able to provide tangible support for improved healthcare outcomes, and this will assist Doctor on Demand's lobbying efforts. All in all, community navigators will again increase the vulnerable, elderly, and chronic disease patient bases and utilization rates. This will create an ample return on investment for Doctor on Demand to hire these community navigators. There's also another exciting opportunity that Doctor on Demand has to train future healthcare professionals through our Junior Community Navigator program. By training these pre-health students, this will be an invaluable opportunity for community encouragement and volunteerism. University students will be trained on the soft skills of medicine and communication and empathy to help create a sense of community in Doctor on Demand's consumer base. Next slide.
So I'm going to speak a little bit more about our plans to scale. One of our first strategies that we want to go about is essentially utilizing mergers and acquisitions. M&A is just a big hot topic right now, just in the space and the markets. And essentially the way we want to utilize it is using it as a main vehicle to scale, just because acquiring or merging with a company allows you to grab more market share in a quick and efficient way. Recently, Doctor on Demand actually merged with Grand Rounds to expand their care navigation capabilities. And this was just one of the great examples that if, there's synergies that are identified early on, and it seems like that, a company that's being merged with or acquired can give Doctor on Demand access to new markets, then that's something that that we would want to do. The next piece is using software as a service. So M&A essentially expands our scope horizontally into new healthcare markets or new subsectors of the healthcare industry. Software as a service expands it vertically. So it allows us to penetrate new markets, broaden Doctor on Demand services, and just cater to different customer segments. So like I mentioned before, employers, insurance companies, health systems, and so on and so on. A lot of the benefits revolving around M&A and software as a service have to do with increasing awareness and increasing just the general brand of the firm, just because a lot more people are using it at this point. With M&A, you're essentially acquiring or merging with the company, and you're grabbing somebody else's target market or their consumers or their patients, and just being able to become a bigger company allows for a lot more people to recognize it and have a stable name in the space. And then another thing is just the increase of the robustness of the technology. As demand increases, technology is going to constantly be stressed all the time. And if you're, constantly looking for different M&A targets that can provide and that can build on that technology to support that demand, that's very essential. And then lastly, it's just an additional income stream coming from M&A and software as a service. So just overall better improves the company's bottom line.
So all in all, Telecor's recommendations for Doctor on Demand is to change incentives of the healthcare industry, which will allow us to change performance on a large scale and ultimately result in changes in the healthcare population outcomes. We believe that telehealth is at the forefront of the changing healthcare industry, and Telecor's recommendations will foster aligned incentives to create a sustainable and profitable business model while also supporting the health and wallets of payers and patients. Telecor's comprehensive plan for success will address barriers in regulation, raise awareness, and increase utilization and scale regarding telehealth services through the lens of Doctor on Demand. We are committed to addressing these issues through our quadruple aim framework, which aims to improve both the patient and the provider experience, increasing population health and decreasing costs on a large scale.
That's it from us.
Okay, thank you, Team Telecor. And so now we'll go ahead and pass it over to the judges for their question and answer session.
Well, I'll go first. Great job, Telecor. Great presentation by all of you. My first question is to talk about the concept of providing community navigation. As patient navigation is such a big topic right now in healthcare, as well as really lends itself to the telemedicine world as well. Do you guys envision the navigation component to be more of a something that helps support the clinical encounter for the patient, or do you even look at it beyond that to be almost a product within itself that you can provide, patients through Doctor on Demand?
Mr. Mishkin, thank you so much for the question. I think it's a little bit of both. So patients can sort of, our idea is that patients can sort of opt in to a community navigatorship. So like if you just have a one-time appointment where you just need to get some antibiotics or something like that, then you may not need a community navigator. It's more for people with chronic diseases, chronic maladies that need constant care. We want to make sure that they are up to date on everything that they need to handle. And especially in the elderly population, which is increasing at a very fast rate, they have a lot of chronic diseases, a lot of chronic problems, a lot of transportation barriers. So telehealth services and community navigators in that effect will help them stay up to date with things that they need to stay up to date with. And also in terms of, literacy, technological literacy, which a few of our demographics may lack, the junior community navigators can be there to sort of help people get started in tech awareness. And so it's really just a helpful tool that the patient can go with or without.
And just to add on to my teammates' suggestions, the Center for Medicare and Medicaid Services recommends hospital systems to set up their own telehealth services for patient populations. So one of the recommendations we have for Doctor on Demand is to kind of help augment those services. And that's why we suggested software as a service. And this would also be a good opportunity for us to provide community navigator support for these programs so they don't have to set up their own.
Piggybacking off of that, the navigators, are you envisioning having them as part of the clinical telehealth path for a patient, or is it a service on its own?
So we want the Community Navigators program to be comprehensive. It's basically supposed to be a support team for each of our patients that's always available to them. Depending on the needs of the patient, some of them may not be as savvy with technology, or some of them may be familiar with telecare services. So the need is going to be different. We just want this to be a resource for our patient base that allows us to differentiate ourselves from the competition. So it wouldn't be a separate service. This is something that will be offered for the Doctor on Demand community.
But if someone's having technical difficulties, as you mentioned, they probably won't realize it until they're having their visit. So is the plan to actually have a navigator as part of that visit so they can assist before a physician comes on? Or when I say separate service, I mean on your app, can a patient just click community navigator alone without seeing a doctor?
Yeah, for sure. So the community navigator is to support care. This isn't like our entire IT department. We'll definitely have information technology services on hand for any mishaps that may happen during an appointment. That will be a 24/7 service. So patients will always be able to get their concerns heard.
I have another question. So you mentioned the home devices, the home kits. If the app is a 24/7 app for patients to access a provider, how do you plan on monitoring those patients with home health kits with chronic conditions? Because that's not just once and you're done type of program. You have to have someone consistently monitoring. So how do you plan on achieving that and staffing that?
For the home healthcare kits, it's more of a when you are in the visit. So you're not just using the home healthcare kit on your own and then like uploading something. It's when you go to your visit, the doctor can instruct you on how to use different aspects of the home healthcare kit to so that way they get more information on their patient. And then you can also, our hope is that with the Doctors on Demand app, the doctor will be able to then input those vitals, and you will be able to see sort of like a live chart or a live showcase of your vitals and how you are doing over time.
Great. And you're also interested in partnering with other entities to develop labs and other diagnostic, tests for your patients. Can you elaborate a little more about that piece of this sort of component of this goal?
Yeah, so the idea is that there's a lot of lab testing that patients don't need to leave their home in order to do. So I mentioned allergen testing, STD testing, even thyroid hormone testing. Those are all tests that can be done at home. And we believe that this is particularly valuable for patients who either live in a rural community where there's not adequate access to healthcare entities, or just for homebound populations that would prefer to stay home. This is a market that we've seen relatively untapped across the different telehealth care services. So we believe it's a unique opportunity for Doctor on Demand to step in.
And I'd just like to add on top of that, we came up, or we identified a potential acquisition for Doctor on Demand to be Everlywell, which is essentially a direct-to-consumer lab testing service without the patient or without whoever's using the services actually having to leave the comfort of their own home. So they can do it, from their home. And we just thought that would be a great identifiable merger or acquisition target just to expand our services.
Additionally, since not all things can be done from home, we thought of partnering with companies like LabCorp and stuff like that, so you can go and get your tests and then have it be uploaded directly to the app or to your doctor.
And one quick question that I had, to cover the cost of these investments of patient navigators and the home kits, how do you go about pitching that idea to some of your partners, community partners?
Well, by expanding the population base and the demographics of people who will need to use telehealth services, such as chronic disease patients and elderly patients, we hope that, especially after the COVID-19 pandemic, which it's awful, but really did help the telehealth industry, we hope that all of these sort of increases in scales and utilization and awareness will drive to higher profits for us, so that we can cover all of these different sort of services that we want to provide, and also long run profits through regularly scheduled visits and specialty care co-pays that will come from the home healthcare kits, and being able to give more services that way.
And just to piggyback off of that, I think what your question is pointing towards, that these are kind of initiatives that are long-term investments, so it might take some time to see increases in profits. And that is true, but I think we're at a point in time where Doctor on Demand really needs to differentiate itself from the competition. And by offering these unique services, we'll be able to do that. And also we're going to provide these services as an opportunity for consulting with other hospital care systems. So they will already be built. So it's not going to be just us using it for our own company. It'll also be an opportunity for us to sell it as a service as well.
One final question from me. Have all of has the team gone through their own telehealth visit as of yet when doing the research here?
Actually, our two teammates that didn't present today both made telehealth visits, and they were, that sort of sparked us for like the home healthcare kits and stuff, because it says when you're trying to make a visit, like, do you have a Apple Watch or something that could be connected? And we were like, let's expand that, let's think on that. And so yes, we did have two teammates go through the process.
Thank you.
Okay. Well, thank you, Team Telecore, and thank you, judges, for those questions. Team Telecore, I'll ask you to go ahead and stop the sharing of your screen. And the judges, we'll go ahead and have you go off into deliberations. Give you a few minute or so to go over into that room. Okay, so it looks as if our judges are off into deliberations. So I'm going to go ahead and share my screen. Now, as the judges deliberate, I wanted to share a brief video, and it's a compilation from 3 past students, and basically chronicling their experience with ACHE of South Florida and the impact that ACHE of South Florida has had on them. The first is Ariana Silcott, who is a recent recipient actually of our 2018 Fall Scholarship. And we also have Kimberly Yohn, who competed in the 2018 case competition and went on to become further involved in ACHE of South Florida. And David Marpour, who competed in the case competition and became very involved in ACHE of South Florida and was recognized for his efforts at our installation dinner. So give me 1 second and I'll go ahead and share that video.
My name is Ariana Silcott Lowe, and I'm a recent alumni from the Healthcare MBA program at Florida International University. I joined ACHE when I was getting my bachelor's in health service administration back in 2013. Now I continue to serve ACHE South Florida as I go through my healthcare MBA program and into my PhD. In 2018, I was able to apply for the student essay competition where I was able to go into my experiences that I was gaining through internship and fellowship, but also through what my career goals were. And I was lucky to actually be chosen as one of the winners. At post-graduation, I continue to serve ACHE South Florida as one of my goals is actually become a fellow of the American Colleges of Healthcare Executives, so FACHE. I continue to contain my membership because it's been very beneficial with my network and being in the global health arena. So I do advise joining ACHE South Florida if you want to grow your network and be able to learn and get face-to-face credit. Thank you so much.
My name is Kimberly Leon. I graduated from Florida Atlantic University with a master's in health administration. While in grad school, I became acquainted with ACHE of South Florida. In fact, my professors championed its value. I learned of that value when I accepted the challenge to participate in the annual case competition. This competition is challenging. I applied learned theories to develop creative solutions. I also learned about the importance of teamwork. My advice: find somebody that is excellent in research, someone that commands a stage presence and can concisely articulate that research. And of course, you need a team member that is going to help you guys stay focused and motivated. I've also learned the importance of being flexible and nimble in the healthcare industry. These are necessary traits in order to be successful. I became more involved with ACHE of South Florida after the competition. I began attending regular events and championing the value of its membership. Membership has helped me both personally and professionally. I have participated in ongoing continuous education. I have received professional exposure and networking opportunities.
This is David Marco, and I'm a recent healthcare MBA graduate from Florida International University. Well, I heard about ACHE from one of my professors who encouraged all of us to get involved in the sense of how you sponsored our memberships and also sponsored some events. I thought, why not? After a few events, I decided to join the Student Services Committee and the networking committee. Overall, it was a great experience for me. I've gotten recommendation letters and got even the Volunteer of the Year award by consistently volunteering in most of their networking and educational events and attended their monthly board meetings. What I mostly got from being involved is not only networking with healthcare leaders, but the mentorship. I can proudly say that I've got some great mentors early on in my career, and it wouldn't have been possible without ACHE of South Florida.
Okay, so I hope you guys enjoyed that video. Like I said, those were 3 of our past students who really got involved with our chapter. And as you can hear, got a lot of benefit from that. So it looks as if our judges are still in deliberation. So we'll give them a couple more minutes before we move on to the closing part of this day's case competition.
I just closed the room, so we're at a 10-second countdown for the judges to be back in the main room.
Okay, thanks, Kenneth.
Sure.
Okay, welcome back, judges. Okay, so we're going to go ahead and close out today's day event. I'd like to introduce Oyokinsola Buki Ogunrinde, otherwise we all call her Buki. And she is our ACHE of South Florida 2021 president-elect, and she'll be delivering the final remarks. Buki has provided numerous years of service to ACHE of South Florida. She served in the capacity of membership chair, student service chair, 2 terms, sponsorship chair, and has received both the Regent and also the Service Award. So Buki, over to you.
All right. Thank you, Ayana. Can everyone hear me? So I'd like to announce that the 2021 ACHE of South Florida Healthcare Leaders Development Case Competition for the undergraduate cohort has indeed concluded. So congratulations to all of you. I can see the smiles of relief. There you go. A round of applause for yourself. Nice, nice. I was really blown away by your performances. So thank you so much for that. I believe we came here to listen to you, but really we're leaving with quite a bit of knowledge and hopefully inspired to much more creative thinking and innovation in this space. So I do want to thank you all once again. Now, I will say that each team will walk away with prizes. Absolutely. We know that. However, I want you to know that that is not the true gains of this experience. The true gains from your participation in this case competition really has to do with the skills that you have acquired, as you heard in our videos and as you may have really experienced yourself: teamwork, flexibility, being resourceful, knowing how to conduct research, presentation. Those are all useful skills that you'll see that you've gained, and those skills will last you for a lifetime. So as we're trying to prepare for this competition and juggling classwork and thinking, why did I sign up for this again? These are the gains that you have acquired, and I hope that you do cherish them. And speaking of cherishing, relationships. Those are the other things I hope that you've gained from this. Whether it's with your teammate, you may have gotten a little closer to them or a little farther away, things happen. Obviously being close to your advisors as you go to them for insights and direction, if you will, but also your mentors. Cherish those relationships. They will last you forever, whether they turn into friendships or even mentorships. I also want to mention that, the biggest gain that you probably may have gotten from this, you may actually not have realized, and that is growth. That is exactly what hard work and perseverance is, and I have no doubt that you experienced those 2 characteristics this time. So embrace it. it will come to use and valuable for you in your professional and personal life. I want to take this time really to just congratulate everyone again. Incredible job, Team Digital Docs, Team Telecore, very impressive, and congrats to you all. I also want to thank the audience who's taking time out of their day to join us today. Fellow students, faculty, family, friends, and all the professionals, we really do thank you and we value your time. Of course, to our incomparable judges, thank you so much. Dr. Thompson, Dr. Mission, excuse me, and Mr. Mansi. Thank you so much for your time. We really gained a lot actually from your questions as well, and we do appreciate you. To the Student Services Committee, thank you so much. Mala, Chair-elect, your hard work has accumulated in today's successful program, and we do thank you for that. Of course, to our president, ever so supportive and just an incredible leader of our chapter organization, Kenneth, thank you. We really, really do appreciate you. And I want to give a special thank you, a special shout out to our leader, the individual who led and brought this program to successful fruition and made today's vision really materialize, Ayanna Miller. Thank you so much. And I want us to all give a round of applause. Amazing. This is all a result of her leadership. And again, it's a pleasure to get to know you and work with all members of the committee and of course with you, Ayanna. So thank you all, and I will turn it over back to you.
I can't think of a better way how to end this competition. Bookie, thank you so much for your words. Really, really appreciate all the efforts that you have put into making today successful. So I don't want to hold anybody much longer. We are going to be finalizing the date and time for the awards ceremony. So we will definitely let everyone know when that is going to happen. I want to also again thank the judges. Thank you guys so much for taking the time out of your busy schedules to participate in this. We really do appreciate it. And the committee, again, thank you guys for all of the hard work. And I hope you guys have a great rest of the day. Those of you who will be signing on tomorrow, we're looking forward to seeing you. You guys have a wonderful day. And
telehealth platform, and they are the highest utilizers of care with regard to our GDP. How do you target that population in including homebound patients and patients in the skilled nursing facilities who do have cognitive and physical limitations, in addition to the technological barriers?
So that's where we were going to have the company have a educational advocate go to those type of facilities to set up the appointments with the nurses and the physicians there to help the patient be able to access the platform, be able to see the provider with the video call. Now, this would be with establishing the relationship with those healthcare facilities and having the advocate explain how to use the platform, explain how to use telemedicine, and then perhaps having volunteers just because, of course, when they are an older population, as you say, they may have barriers in terms of physical and mental awareness. And that's why having someone that actually understands how to use technological devices and understand how the platform use is something that needs to be implemented in order to assist them.
Quickly in adding to what Ariane said, basically implementing an in-service, to reach out to these assisted living facilities, maybe kind of teach them, hey, this is a service that you have. This is something that you have available to you. Do you have any questions? let me just show you really quick how you can do this on your phone. So when they're alone and when maybe their caregivers are not around, they have more of an idea how to use it. Basically an in-service, and to maybe the assisted living facilities explain to the personnel and the caregivers, you know, it's simple. Let me just walk you through it in case you have any questions. Kind of like make them advocates as well for Doctor on Demand.
In your SWOT analysis, you mentioned that one of the weaknesses was that Doctor on Demand only had video as an option. Doctor on Demand is a telehealth company, and I'm curious as to why you think that's a weakness, but if it is indeed a weakness, what would you do to change that?
So there's going to be a large population that doesn't have access to smart devices, such as like a webcam, a phone with a camera. Some of the older people might just have simple flip phones. There are other companies, there's other the competition in the market that offers telephone consults. Maybe some people don't feel comfortable being on camera. So that's why we think it's a weakness for the company.
Now, maybe adding a telephone option might be a way to work with that, maybe a phone call compared to a video chat.
Yeah.
What ideas and options do you have to incentivize physicians to move to this platform? My platform is a cash-based practice. Why would I leave my cash-based practice to work for Doctors on Demand?
Well, there's a lot of positives. Doctor on Demand allows you to work from home. You know, as we've seen lately with COVID, that's something that people do take advantage of, that they would enjoy, make them feel more comfortable at home. And basically, you can work on your own time. You know, you can sign in to your Doctor on Demand account, treat patients, and if you have an errand, you have something to run, it's very
convenient,
easy to monitor your time. It's convenient. So yes, of course, with your cash practice, it is different, but you can work from home.
Yeah. Also, they can save money in terms of if they were only using the telehealth services, or if they work inside a hospital and they don't have to have an actual physical building where they have to pay all of that in rent, medical equipment, etc. It might be cost effective for the physician to have a higher amount of patient care provided through telemedicine and through Doctors on Demand. Now, in terms of practicality, as Christina says, it's going to be easier for the physician to manage their time, to potentially have more space for more patients. So because there's maybe less of a delay between patients, they may be able to have an easier transitions between patients, and therefore eliminating the waste of time, and that can increase profits for them as well, because they can have more patients. So more patient would mean that they would have more revenue.
I'm curious, has anyone on the team had a telehealth visit, experience a telehealth visit?
Yes. So I work for a cardiology office where we're implementing both in-office and telehealth visits. I've also used it on my own through the company.
So
I have myself as well.
Donalyn,
Yes.
Being in the cardiology office, do you think it would be practical to have all online business, or would it need to be a half and half of business between virtual and in person?
So I think for every area of medicine, you're going to have difficulties. With cardiology, one of the biggest problem that we get is like patients asking, how is the doctor going to like know my heart rate? How is he going to do the test? For simple things like as home remote monitoring, blood pressure monitoring, Holter monitors. That's something that can be done remotely and in the office. Well, not in the office, that we can do in the office, patients can stay at home. But for bigger exams, I would say that's something that has to be done in person, like ordering echoes, ordering stress tests, any type of like MRIs. So I would say for big tests and exams like that in the office, but for anything that requires monitoring, going over medication, definitely can be done through telehealth.
Yeah.
If no one else has a question, I have another question. In your KPIs, they seem to be all business-related KPIs for growing your business. Have you considered any clinical type of KPIs that you can use to show any potential customers that you are improving the overall healthcare of the patient population?
So I would have to say quality.
Right. Yeah.
So we would want both the clinician staff to be working in an area where they feel comfortable and they're able to deliver the quality of service that the patients deserve. So definitely satisfaction, like doing surveys, making sure that everybody's on board with what Dr. On-Demand is trying to provide.
Yeah, so that's why I had in terms of the key performance indicator, quality of care would be measured by the anonymous surveys. So the idea would be for the patient, when they have already set up the platform, they've already used it, when they log in, there would be a short survey that would assess what do they think about the app itself? What do they think about the quality of the service? And then I would have 2 or 3 suggestions that they would need to say, all right, this is something that I'm interested in, and this is not something I'm interested in. For example, having the use of text messages rather than just video call. And then you see, does the patient actually want that type of service? And then the same type of survey would be implemented towards the physicians and the providers to see what is a barrier to the physicians in order to provide the best care possible for their patient using the platform. So this would be measured with the anonymous surveys, and they would be used to implement what needs to be actually improved in terms of the platform based on what the patient and the physicians are saying.
All right, thank you, Team New Era Consultants. I'm gonna go ahead and ask that you stop the sharing on the screen. And you guys can actually go ahead and sign off on the call at this point. We're gonna have Team Feast Consulting go ahead and set up, and we'll have our judges go ahead and move over into the deliberation breakout room.
Thank you.
Thank you.
Bye.
All right, I think our judges are over into the deliberation room. So while we wait for the judges to come back, I just want to go ahead and share a video. So with this video, it's a compilation of 3 of our past students and their experience with ACHE of South Florida and the impact that ACHE of South Florida has had on each of them. The first student is Ariana Silcott, who was a recipient of our 2018 ACHE of South Florida Fall Scholarship. Our second student, or past student, was Kimberly Leone, who competed in the 2018 case competition and went on to become further involved in our ACHE of South Florida chapter. and David Marpol, who completed or competed rather in the case competition and became very involved, volunteering quite a bit with ACHE of South Florida, and so much so that he was recognized for his efforts at our installation dinner. So I'll go ahead and share that brief video with you.
My name is Ariana Silcott-Lowe, and I'm a recent alumni from the Healthcare MBA program at Florida International University. I joined ACHE when I was getting my bachelor's in health service administration back in 2013. Now I continue to serve ACHE South Florida as I go through my healthcare MBA program and into my PhD. In 2018, I was able to apply for the student essay competition, where I was able to go into my experiences that I was gaining through internship and fellowship, but also through what my career goals were. And I was lucky to actually be chosen as one of the winners. At post-graduation, I continue to serve ACHE South Florida, as one of my goals is actually become a fellow colleges of healthcare executives. So at ACHE, I continue to contain my membership because it's been very beneficial with my network and being in the global health arena. So I do advise joining ACHE South Florida if you want to grow your network and be able to learn and get face-to-face credit. Thank you so much.
My name is Kimberly Leon. I graduated from Florida Atlantic University with a master's in health administration. While in grad school, I became acquainted with ACHE of South Florida. In fact, my professors championed its value. I learned of that value when I accepted the challenge to participate in the annual case competition. This competition is challenging. I applied learned theories to develop creative solutions. I also learned about the importance of teamwork. My advice: find somebody that is excellent in research, someone that commands a stage presence and can concisely articulate that research. And of course, you need a team member that is going to help you guys stay focused and motivated. I have also learned the importance of being flexible and nimble in the healthcare industry. These are necessary traits in order to be successful. I became more involved with ACHE of South Florida after the competition. I began attending regular events and championing the value of its membership. Membership has helped me both personally and professionally. I have participated in ongoing continuous education. I have received professional exposure and networking opportunities.
This is David Marco, and I'm a recent healthcare MBA graduate from Florida International University. Well, I heard about ACHE from one of my professors who encouraged all of us to get involved, and since FIU sponsored our memberships and also sponsored some events, I thought, why not? After a few events, I decided to join the Student Services Committee and the networking committee. Overall, it was a great experience for me. I've gotten recommendation letters and got even a Volunteer of the Year award by consistently volunteering in most of their networking and educational events, and attended their monthly board meetings. What I mostly got from being involved is not only networking with healthcare leaders, but the mentorship. I can proudly say that I've got some great mentors early on in my career, and it wouldn't have been possible without ACHE of South Florida.
Okay, I hope you guys enjoyed that video. We are going to give the judges a few minutes to complete their deliberations from the last team's presentation. So if we'll just allow a couple of minutes. And Team Fees Consulting, I see you guys there. You can wave. Okay, good. You can hear me. Okay, perfect. Okay, I see our judges are here. Thank you, judges. So I'll go ahead and pass it over to Team Fees Consulting.
Thank you. Can you hear us okay? All right, awesome. So we're just going to share our presentation now. No. Oh my God. Okay, just give us 1 second. We're just sharing the screen. All right. Good morning, everyone. My name is Elizabeth Wren, and on behalf of Fees Consulting, we want to thank you for the opportunity to speak and provide our recommendations for Doctor on Demand today. Before we get started, we wanted to give you a little background on who we are. Some notable achievements of our firm are successfully securing over $1 million in funding for healthcare nonprofits. We have consulted 25 large healthcare organizations, and we have recruited over 500 physicians and staff with a 30% decrease in turnover rate hire. One of our biggest strengths is negotiating managed care contracts with primary care providers and large healthcare organizations, resulting in $2.5 million. Our leadership team consists of 4 people: Felicia, Edric, myself, and Sylvia. Hence where the name Fees Consulting came from. F for Felicia, E for Edric, E for Elizabeth, and S for Sylvia. Our team has 20+ years of consulting experience combined within the healthcare industry, and it has been a great experience working with Doctor on Demand. As we begin, we'd like to give you a brief overview of Doctor on Demand. Currently, the company markets themselves as being affordable, simple to use, and convenient to access. In 2020, during the coronavirus pandemic, Doctor on Demand's appointments went up by 139%. They raised $75 million in expansion costs and completed over 3 million virtual visits as of December 2020. They are also known as one of the first telehealth providers to support over 33 million Medicare Part B beneficiaries.
Thank you so much, Elizabeth. I am Sylvia, and I will go over the current state of Doctor on Demand. So as we did more research, we realized there were a few things that prohibited Doctor on Demand from reaching its full potential. Currently, their services and treatment options are limited. There are fewer therapists available versus other online platforms. And we saw barriers to communication that included difficulty signing up, lack of customer services, and only having video options available. Furthermore, we realized that the scale of physicians only reach so far as primary care physicians. Having to send patients out for lab testing and referring them to specialists outside of Doctor on Demand's platform constricted them from treating and caring for patients all inclusively. They are also currently under the current fee-for-service model that influences physicians and clinical staff to think quantitatively versus qualitatively when visiting with their patients, which can all negatively affect the patient experience. This model also imposes regulatory issues that Doctor on Demand's physicians incurred while navigating the licensing process. What was most striking to our consulting firm was the unreasonably high prices for short visits. The most common for a typical visit with Doctor on Demand was $75 for a 15-minute consult, $129 for a 25-minute consult with a psychologist, or a whopping $299 for a 45-minute consult with a psychiatrist. These prices are just simply unsustainable for the average person. I mean, would you pay that yourself? After job loss and worsened health conditions during the COVID-19 pandemic, we realized that this was the perfect time for Doctor on Demand to make some adjustments to the company. With all that being said and researched by our firm, I believe that Hill Ferguson, the CEO of Doctor on Demand, actually said it best. Doctor on Demand has the potential not to just be the next generation of telemedicine, but the next generation of medicine.
To ensure our research was all-encompassing, we also chose to complete a SWOT analysis of Doctor on Demand as displayed on the slide. But ours is structured a little bit differently. We assessed the strengths, weaknesses, opportunities, and threats. We started out with the strengths, those being the easy accessibility on multiple platforms that included both mobile and PC, no hidden fees, around-the-clock availability, short wait times, relatively easy scheduling, and partnerships with several large employers and insurance companies. Some threats that came from the conversation also included telehealth companies that are emerging post-COVID-19 pandemic. We realized that the utilization of telehealth will be more specific and direct to certain populations, which may direct traffic away from a company like Doctor on Demand. Some opportunities, however, did spark from this conversation too, such as increased partnerships with more employers and insurance companies, patient education and marketing enhancement, provider and specialist preference options, and the opportunity to just completely shift the healthcare model to a more value-based one. Understanding our current state was important in order to visually see what resources and tools that were available to make these changes. Like we stated before, the high pricing, limited services and tech capabilities, and the quality of healthcare currently being delivered had started to just negatively affect Doctor on Demand's reputation.
Thank you, Sylvia. I'm Felicia, and I'm going to be discussing the future of healthcare. So where does that leave us? Being a healthcare worker and executive means understanding and being comfortable with the landscape of the industry, which simply put is constant change. The coronavirus pandemic challenged many healthcare organizations by forcing them to transition to telehealth medicine. The fee-for-service model shift to value-based healthcare models have made patients increasingly aware of the intentions and missions healthcare organizations work under. And on the flip side, it has also made patients comfortable with what we at Feast Consulting like to call emergency care, which is only seeking healthcare when there is an issue or a symptom progression, rather than regularly visiting their physicians and all specialists with a preventative agenda in mind. We are going to propose a model that extends beyond the technological aspect of Doctor on Demand. We felt it was important to examine the issues from a systemic perspective. So with all of that in mind, we at Feast Consulting are proposing an Independent Physicians Association, also known as an IPA, pilot program. We've drawn out the very surface level details of this program on this slide, which are targeting 1 million people covered under the Humana HMO plans through the selected IPA, a 50-50 risk and shared savings contract within the IPA. The duration will be 2 years, and we will offer subscription plan options for patients. Doctor on Demand's catchphrase is improving the world's health through compassionate care and innovation. And this pilot program would really be putting that to the test. So why a pilot program? You know, we understand that in the healthcare industry, change does not happen overnight. We want to make sure that the program is successful in its pursuit. With our team's professional and educational experience, coupled with our research, our focus is to refine, revise, and optimize the value-based care model within Doctor on Demand. So to give you a higher level overview of the details of this program, we wanted to outline the advantages of each stakeholder in this program as it correlates to cost, access, and quality, the three main components we believe are successful to every healthcare organization. The most important stakeholder in this pilot program is absolutely the patients. They will be given 3 options for a subscription plan. This allows the patient to access a greater number of services within an affordable price range. Due to the fact that this model will be under a value-based platform, the quality of care that will be delivered will be in a more preventative and more compassionate way. The patients will also be given longer visit times with their physicians to ensure an opportunity to explore all concerns and to develop a longer lasting relationship with their physician. Now, for the physicians involved, the pilot program suggests a capitated payment schedule for more regulated, consistent pay. In addition, under the managed care and IPA model, physicians and clinical staff will have the opportunity for performance-based bonuses, sharing 50% of their surpluses with the IPA should they reach or maintain a certain benchmark in their quality measures.
By being a part of this IPA network, the physician scale will be much larger, giving them the freedom to choose their own schedule and access their patients more regularly. And like we mentioned before, this also gives them the opportunity to get to know their patients on a more personal level. So this also increases the likelihood of early symptom identification, which also increases the opportunity for shared bonuses. And lastly, the insurance companies will likely see lower utilization rates from Doctor On Demand by being involved in this pilot program. The IPA will have various internal teams such as quality, health services, and pharmacy teams that will review utilization reports monthly that will assist the physician with proper documentation for accurate risk-adjusted factor scores, pharmacy cost savings, and hospital admissions follow-ups. All of these things largely impact the amount of cash flow needed to treat and care for patients. If the pilot program proves to be successful, we anticipate to expand throughout other HMO populations throughout the country. The quality of care provided to the HMO population in this program is expected to be enhanced or increased, and we will measure by comparing Medicare risk-adjusted or MRA scores.
Thank you, Felicia. So how exactly will we measure our success in this pilot program? We will do this in two ways. First, once a Doctor On Demand is contracted with the IPA, we will be able to access the CMS patient reports that will provide us data from the last 3 years. We will identify the current state of these patients to create a baseline and then track the MRA scores at the end of year 1 and again at the end of the pilot program. Our goal will be to ensure that under the managed care model, patient quality care is improving or at least being maintained if they are assumed healthy. Secondly, we will deploy patient satisfaction surveys at the start of the program and every 6 months until the end of the program thereafter. This is to ensure that the patients are consistently happy with the new model of healthcare that is being delivered, and they will have access to everything they need to be healthy. As far as the potential hurdles, with any pilot program, it is important to recognize and understand potential hurdles to know how to navigate them if they come our way. Provider adaptability, patient insurance change, financial burden, 2-year time constraint, IPA competition, and patient satisfaction can all pose a potential roadblock on the road to success for the IPA program. Furthermore, scalability. We hope that if the IPA programs prove to be successful with Humana HMO population, we will work to contract with other major HMO plans after the completion of the project within a 5-year time span. And as you may see from our slides, we have our expected timeline. As listed on the screen, we have outlined each goal within a 6-month checkpoint. This is to ensure we are maintaining or exceeding initial benchmarks gathered at the beginning of the pilot program.
Thank you, Edric. So now I'm going to speak a little bit about our financial analysis. When working with an HMO population, it is vital to understand how documentation and coding impacts the financial landscape of the healthcare organization. Simply put, each diagnosis or condition is attached with a certain Medicare risk adjustment or risk-adjusted factor score. Improperly coding a patient's condition can result in insufficient funds the CMS disperses to the provider to care for that patient, leaving the provider and their insurance company into a deficit. The IPA pilot program will work to improve this challenge, having quality teams to review historical patient data and office visit notes to ensure completed accuracy. So in order to ensure a more regulated, consistent, and fair environment for the physicians, we hope to transition the fee-for-service providers to a capitated model, allowing them to have $100 per patient per month. With the shared savings contract model, the provider will have the opportunity to have 50% of any bonuses inquired from increased quality and performance outcomes. Providers have the ability to increase their average annual net salary by 75 to 100%. Increase in average annual net physician surplus under the IPA managed care model. Lastly, comparing the subscription cost to average yearly spending for the average person, this will save them an average of $15,000. Let me say that again, $15,000 in out-of-pocket fees.
Thank you so much, Elizabeth. So as my colleagues mentioned, we will use the MRA and RAF scores to monitor our results. We anticipate that with the success of the program, our members will have around a 1.5 RAF or MRA score, as well as a 4.5 stars in patient satisfaction scores, which we'll continue to monitor as the program rolls out.
Thank you, Sylvia. So in conclusion, to be more competitive, Doctor On Demand needs to find new ways to address cost, access, and quality. With our proposed IPA program, we anticipate that Doctor On Demand can expand healthcare access through the IPA's large network of physicians and by increasing services available. The program helps to reduce healthcare costs to Doctor On Demand, IPA participants, and patients, thanks to the 50-50 shared savings and capitated payments and subscription services. Lastly, we anticipate Doctor On Demand will improve the quality of care delivered since the IPA program is based on the value care model. The use of the MRA and risk-adjusted factor scores will help to ensure we are in the right direction as the program rolls out. With tackling access and cost, the IPA program can ultimately produce high patient and physician satisfaction. So with that, this concludes Fees Consulting's presentation. We thank you all for the opportunity to present our recommendations for Doctor On Demand, and we look forward to hearing your feedback. And at this time, we'd like to ask for any questions that you may have.
Okay, thank you, Consulting. So go ahead and have our judges begin the question and answer session.
You want to go, Will? Or
Sure. So great presentation, guys. I think that it was structured very well and the information you provided was very good. So thank you for that. The pilot program shows that the target market is about 1 million people. However, on a few slides before that, you mentioned that the availability of physicians is an area of opportunity. What's your plan to staff up with physicians or cover the lives of 1 million people when you have limited availability?
Good morning. So that was a great question. Thank you so much. So being part of the IPA program, you actually will gain access to these other physicians. We did some research and we have an IPA program in Florida called Integrated Independent Physician Network. And they currently have already, they work with a pediatrician, they work with urgent care, they work with diagnostic centers. So they have a pretty good graph so far of providers. We're hoping by working with an IPA program such as them, that this would increase physicians as well.
As a physician who practices telehealth, what is the benefit for me to join your IPA?
You're good. Okay. Thank you so much for holding. So one of the major benefits of the IPA program is that they take away the administrative burdens that a lot of physicians face, especially those in independent practices. So I know CMS has a lot of requirements when submitting things, and what the IPA does is basically handle that. So as a physician, you won't have to worry about that burden, so you can focus more on the quality of care that you're delivering to your patients when you don't have to worry about all that paperwork. Not only that, but you get to benefit from the surpluses that the IPA get as well. So when the patient receives better care, they have better health outcomes, which means the IPA receives more money, which means you receive more money as well. So you are able to deliver better care, reduce administrative burdens, and also increase bonuses.
Thank you.
So I'm a geriatrician and a palliative medicine doc by training. And when you pilot your program that targets 1 million people, I get concerned about the other 40+ million geriatric patients that are potential patients. While you're piloting this program for 2 years, other competitors are going to be on the rise. How do you compete with them while you're only targeting 1 million people?
Okay, thank you so much. That's actually a very great question. So with any IPA that's integrating into a fee-for-service structured model, that change, like we said, does not happen overnight. So when you shift the model from fee-for-service to value-based, that's why we incorporated the pilot program to allow us some time to shift our physicians and change their behavior in order to treat their patients better. So in order to combat competition, we really wanted to focus on a smaller population just to ensure the success of the program. That way, after the 2 years is up, we can incorporate other HMO populations and have more likelihood of success because we had already focused on the one and were successful in those measures.
Yeah, and I also just want to add, the IPA program is in addition to what Doctor On Demand already delivers. They are the first telehealth company to actually deliver services to Medicare Part B recipients, which do tend to the older population. So they will be receiving care as well on top of the Humana 1 million population that we are proposing in this program.
You listed provider adaptability as a potential hurdle, and it's a true hurdle. How do you plan on overcoming that hurdle?
Okay, thank you so much for that question. That's a great question. And it actually can impact a lot of the success in the pilot program. This program does require buy-in from the providers that are involved. So by showing them the success of other other IPAs and the bonuses that they receive from this program and the increased likelihood of closer relationships with their patients and increased health outcomes, we hope that by providing this data, we will see more of an increase of providers wanting to join an IPA because of all the benefits that come from it.
Do you have any plans to outreach for the socioeconomically disadvantaged group that are high utilizers of care?
So thank you. Yes, we definitely will be reaching out to them. So this came back to when we first thought about how to go about this with the IPA program. We really wanted to think about, the people in the lower end populations, the rural populations and them in general. So when we wanted to reach out to them, we already noticed that about 2/3 of senior citizens either have, technology themselves, some sort of Wi-Fi, and they also have access to a smartphone. And then about 80% of them already utilize text messaging. So a population such as themselves can adapt well to already the Doctor On Demand. And then besides that, when people in rural areas do want to use something like Doctor On Demand, they already adapted to this. We started off with telehealth for rural areas. So they're either used to going 50, 100 miles out or utilizing some sort of doctor on demand platform. So going out to them, they already are knowledgeable and they already know about these sort of resources.
Can I interject? Yeah, sorry, I just like to add a comment. So with the IPH structure and the opportunity for shared bonuses and the surplus, if we should, incur a surplus, we would like to utilize, as an IPA, we would like to utilize that surplus available to increase awareness and services available in those underserved and rural populations. So those surpluses could be for incorporating kiosks in various areas that are free for people to use, like churches or city halls or malls or things like that, even long-term care facilities or SNFs. We would like to incorporate some of our services in those areas with those surpluses.
Feel free to ask, don't be shy.
If the judges have concluded the questions, yes?
Yeah, Chad.
Yes, okay. All right.
Thank
I'm good.
Yes, thank you guys so much.
Thank you.
Keys Consulting. It was a great presentation. So at this point, we will have the judges move back into the deliberation breakout room. We also are going to go ahead and start a 10-minute break session. So it is now 11:02, and so we will start back at 11:12 with Glasses Inc.'s presentation. Feel free though to stay on. I'm going to go ahead and share with everyone a PowerPoint that just kind of highlights all of the great things that have been happening within ACHEF South Florida. So judges, I guess, yes, they have moved off, and we will convene again at 11:12.
I'll take it on the next break.
Sounds good.
Is Harula on? Is she on?
No, I don't think.
Okay.
Okay, hello everyone. I think do we have Glasses Inc? Everyone from Glasses Inc is on? Yes?
Yes.
Okay, we're going to give it just a couple of minutes for the judges to come back, and then we can go ahead and get started. How are you guys doing?
We are doing good.
Okay, good, good.
Should we go?
Can we, I guess, take it for mic check? Can you hear?
Yes, we can. I can definitely hear you. Yes.
Perfect.
I was wondering about the name, but I think I figured it out now.
You know, that would be that everybody would be wondering why Glasses Inc.
But you know now.
Yeah, we're like.
Yeah. Good start for branding.
Yeah.
Immediately recognizable.
Should we put the PowerPoint up to see if it's okay, or should we wait until the judges come?
If they, it's actually just one of our judges that we're waiting for. So you just give it a minute.
Okay.
Should I make all of you co-hosts, or is there one of you that's going to be lead for driving the presentation?
I will be driving the presentation.
Okay, excellent. I just made you co-host, so you should have sharing capabilities now.
Thank you.
You're welcome.
And we actually have our three judges here. So you guys can go ahead and start.
Perfect.
Well, everyone, good morning. Thank you for being here with us. My name is Nelsa Vera Farron, and I'm accompanied today by my teammates, Gretel Gallo, Anicia Hogg, and Hamala Sharma. And together we make up Glasses Inc. And you may find it strange and wonder why we chose that as our name, although looking at us, you probably don't now. But the reason that we chose it is because we all wear glasses, and as any of you that also wear glasses know, you certainly need them to have a clear focus of what's ahead and to be able to see 2020, right? So we thought that was a perfect name for us. We are determined to provide a plan that will help grow Doctor on Demand into one of the top telehealth companies in the industry, and we are pleased to welcome you to our presentation. Slide, please. So Doctor on Demand is a wonderful concept, especially given the changes brought about due to the COVID-19 pandemic. The case study introduced us to some obstacles the company has been dealing with that needed resolution. And as you can see from this slide, the first thing we did was complete a SWOT analysis of the organization. We examined the strengths such as cost effectiveness and visit fee only, which means that there are no subscription fees. We looked at weaknesses such as the lack of user-friendly platform, low utilization, and limited staffing. We looked at opportunities such as current CMS regulations that have been relaxed due to COVID-19. And finally, we looked at threats such as competitors and shifting CMS policies. Slide, please. So upon completing the SWOT analysis, we then moved on to identifying strategies, looking to create goals and objectives. And as you can see from this slide, our strategies are marketing to consumers and employers in order to increase awareness and utilization, expanding provider services, specifically looking to increase mental health, holistic, bilingual, and multilingual providers, improving user experience, as one of the things we noticed were frequent complaints regarding issues with the platform. Our recommendation then is to revamp the website and make it more user-friendly, as well as translating the website and app in order to be able to service more patients. We believe that instituting a quality improvement process will aid in the growth of the organization, and that supporting current telehealth expansion and interstate licensing efforts will aid in regulation initiatives. I would like to now welcome Gretel, who will address our marketing strategies.
Thank you so much. So on the left of this slide, you see 2 current Doctor on Demand video ads, which feature snapshots of people who represent diversity in the US. While this is great for a general audience, we think that Doctor on Demand can take advantage of a trend in the marketing industry called content marketing. The purpose of content marketing is to personalize ads for specific target audiences within the general population in order to build community around a brand. 90% of consumers find this appealing, and 63% of consumers will actually disengage with a brand that feels too generic. By increasing its diversity of new hires, which we'll discuss later, Doctor on Demand is poised to brand itself as a leader in holistic care, which, as you can see, is increasing in popularity in the US. Next slide, please. So in the next 2 slides, we're going to show our recommended target audiences for the general public, and we'll show related demographics that show why this is a sizable group in the US and what ad messaging resonates with them. So here you see we recommend marketing to people with mental health conditions, chronic health conditions, non-native English speakers, and Medicare and Medicaid beneficiaries. For people with chronic health conditions, it's important to have convenient, accessible services, which are clearly a feature of telehealth. And as I'm sure everyone has seen during this pandemic, there's an increased focus on mental health that requires privacy and responsiveness, which telehealth can absolutely provide. The CMS waiver, which we'll also discuss later, introduced telehealth to CMS beneficiaries, which we'll want to retain past the pandemic. And finally, the number of people who are non-native English speakers in the US is growing each year, but they remain an untapped market with language-based needs that affects their access to care. Next slide, please. Next, we recommend marketing specifically to caregivers, particularly young mothers, young professionals, and rural Americans. Competing companies like Teladoc, American Well, and MD Live are already marketing to young moms because of their purchasing power in the US. And we know that they are very receptive to cause marketing and especially holistic lifestyle brands. I think we all know that millennials and Gen Zers, we can't be separated from our phones, and we highly prize convenience, while rural Americans represent a traditionally untapped and underserved health market that telehealth is best equipped to reach far and wide. Next slide, please. So we've already spent some time discussing how the general public can be divided into different groups. The last two slides went over that, and here we're going to discuss business to business marketing. The case study also noted that companies and insurance providers were not promoting doctor on demand adequately to their beneficiaries. So we'll offer discount rates to companies as more beneficiaries use doctor on demand. We can share instructional guides with step-by-step instructions for first-time users of doctor on demand. For small companies that are potential new clients, we'll offer negotiated reduced rates to reduce the financial burden of insuring their employees. We also recommend switching the focus from CFOs to COOs, since COOs are in charge of operations costing and present their findings for approval to the CEO and CFO. The merger that happened last month with Grand Rounds offers the perfect opportunity to bring up doctor on demand with COOs. Next slide, please. So based on all the different target audiences that we presented, and based on the media consumption behaviors of different target audiences, we would recommend creating a marketing mix like the one you see here. For example, if you look on this slide, for people with chronic or mental health conditions, you can do a partnership with foundations or support groups and advertise your services through them. In addition, marketing mix can be changed to vary according to your budget, and you can use analytics to refocus your campaign performance as you go. For example, social media ad campaigns tend to be cheaper, roughly about $1 per user or per click, than traditional advertising placements like TV or radio ads. And you can get more immediate feedback on how your campaign is doing and changing accordingly. Next slide, please. So here we picked Tampa, St. Petersburg as an example for you to see how marketing mix can be applied to a specific geography. The reason we picked Tampa, St. Petersburg is because it has many demographic elements that make telehealth relevant to the area. So if you look on the left, something that is unique about this area is that 28% of households have a non-native English speaker in the household, which is very high for the average per state in the US. You also see that the patient to doctor ratio is very beneficial to telehealth. Most of the population in this area is insured and has internet. 43% of people are actually employed as an employee through their employer's plans. And Florida is already in the interstate licensing compact, which would facilitate the regulation of licensing for physicians. So because this is an area of interest, we basically on the right, if you look on this chart, based on average spend for each type of marketing ad, we did an estimate. Also based on essentially the census population and like the amount of people per that population. So you see non-native English speakers, we've determined that that's above 100,000 potential clients, employee plans, you see the number of potential clients there. And then we've done marketing mix for that and approximate spend based on averages. Something else that we thought was unique about Tampa, St. Petersburg is that it has a lot of university students. So that's like perfect place for social media campaigns at $1 per user. And you can even go through university health plans to market to them. So with that, I'll pass it on to my colleague, Kamala.
Thank you very much, Gretel. I'll focus on the recruitment, provider recruitment plan, which is critical for any organization. The telehealth environment has changed considerably due to COVID-19. There's already a national shortage for medical staff, and the expansion in the healthcare industry has drastically increased the demand for telehealth provider. And doctor on demand is also facing those similar challenges, recruiting doctors and retaining doctors as well. Doctor on demand recruitment strategy is a good way forward. It has excellent benefit. It focuses on benefit, pay, and quality of life. And those are the primary three areas that you want to focus on a recruitment strategy. We will continue to build on the existing strategy by focusing on specific target groups to increase recruitment and retention. The first target group that we will focus on is physicians with children. Presently, physicians with children, there are 77.5% of female doctors who work part-time or have to quit their job. This is a population that we can basically focus our recruitment on, since it will provide them an opportunity to maintain their license or either work part-time at home where they can be with their family as well. The next target group that we will focus on is newly graduate medical provider for part-time position. We are aware that they will need hands-on experience, and I think that's the reason why we don't go on a full-time, but we focus more on part-time, because when we look at it, most medical providers that graduate owe between $250,000 to almost $330,000. I know most medical professions take this job because they care for patients as well, but we also have to care for our mortgage and our bills and student loan as well. Bilingual and multilingual. We're looking at this in sense of a long-term goal. And long-term because it's not something that you could just implement. You need people to be trained to provide that service as well. Presently, some insurance and also Medicare and Medicaid provide translation service. Still, people that speak limited English language are not receiving the same quality of care as everyone else. For example, based on stats, 138 million people will speak Spanish by 2050. Our goal is to provide training for staff that we recruit to speak different languages as an incentive. And like example in California, and Florida, where we have a really high number of people that speak Spanish, we can even provide the service in Spanish as well. This is something that also can guide for expansion of doctor in demand in the future as well. We know we cannot focus on all languages as well, but we will try to focus on the top 5 first and then gradually continue from there. Like we said, this has to be based on location and also the doctors that is available that can speak the language as well. We also focus on mental health and holistic care provider. Doctor in demand basically look more of an urgent care right now. We want to transition from an urgent care to also focus as being someone that focus on holistic care, where you can come and see your primary care doctor as well. Next slide. The recruitment strategy is critical for expansion and success of doctor in demand, since increasing patient will increase the demand, and it will also affect our bottom line. What we will do is continue to focus on flexibility and convenience of working from home, training and education fee, licensing for other states to increase access to patient. And most of the times, if the doctors are based on how many patients they see, doctors are paid based on the amount of patients they see. And if they have licensing for other states, it means they have more access to the patient they see as well. Additionally, we will provide a sign-on bonuses. Sign-on bonuses is because over the last year, the competition has increased. There are a lot more services that are competing for the same resources as well. We'll continue to use multi-channel marketing approach to recruit medical service provider by using the website, direct mail, email to provider, recruitment representative, and we can even use ACHE as a way to recruit providers as well. And also we place strategic ads in Becker journals, America journals as well, where most medical staff read as well. Next slide. We know a lot have changed over the years. What we want to do is maintain the change that was made due to COVID-19. And especially those related to Medicare and Medicaid as well. I mean, when we look at Medicaid, this is over 70.5 million people. And when we look at Medicare, that's 63.1 million people. That's a large market share. And I know every company is trying to get as much as they can from that market share. We, at this point, we know there's changes, but the question is, what will happen after the pandemic? Will regulation change? Will the regulation stay the same? And that's the reason why we will continue lobby with other companies and organizations to maintain these changes as much as we can. We know the CARE Act authorized the Health and Human Services to take several steps to make telehealth service more readily available. And also we have the Connect Care Pilot program, which is extended for 3 years. So we know the environment is going to change. We know the federal government already invested a lot of money. But the question is, how much is going to change after the pandemic? And that's our biggest reason why we want to continue lobbying. We don't want to sit back and say, hey, everything is going to change. We want it to change to benefit us. We want to access those over 70.5 million people in Medicare, 63.1 million people in Medicare, workers and insurance companies that are also now implementing telehealth as part of their program as well. Thank you very much, and I'll hand you over to my coworker, Anika.
Lessons Inc. is currently proposing to increase utilization with the app by adding the top 5 languages, thereby giving users the ability to adjust the language they are comfortable with, and with the expansion of additional language in the future. We have identified with the current platform that it was not user-friendly, and based on surveys, patients were not satisfied with the length of visits due to the copay that they pay. Now, what we're suggesting is a more user-friendly platform, extend the visits to 20 minutes so that patient needs are being met. And this is suggested by surveys that are completed by the patients. Now, we're also suggesting patient screening to ensure that patients are paired with the correct service and providers that they need. Now, we're also going to do quality improvement, and what better way to do that than to improve the quality of the website so customer complaints are addressed, and then it will effectively help us to improve the utilization of data analytics by creating exit surveys for both patients and employees. With that, this concludes the end of our presentation, and we now open for questions.
Okay, thank you, Glasses Inc. And so now we'll begin the question and answer session from our judges.
All right.
Go ahead.
No, please.
Okay, good job, guys. Really, really nice presentation. So you guys are in your SWOT analysis, especially looking at your user experience, and really, you know, a lot of telehealth platforms, I don't see the translation services really resonating that well as you guys. So I think that was a really creative idea. Are you also proposing that you're going to ensure that you really have a dynamic group of providers that are also going to be able to provide the clinical care to those patients as well, and you're going to be able to match, you're proposing to match that up to the specific providers, and if so, how are you going to be able to do that and recruit those providers throughout not only just primary care specialties, but some of the other care that you want to provide as well, mental health and other types of services?
Right.
Go ahead, Greta.
Yeah, so we definitely acknowledge that it is a very competitive market for multilingual providers. So we definitely think that focusing on their needs, right, especially like new grads may have loans, so a sign-on bonus. The idea of that is to not just incentivize newer grads, but also mid-career and later on in their career.
I will also add something to that. When we talk about screening patients before they come in, the screening process would actually decide if a patient is an urgent care or primary care setting. if it's a primary care setting, we'll focus on doctors that are working more full-time positions so that the patient can feel like they can go to the same doctor themselves, or even use an appointment system. So it increase continuity of care as well. So that part, we're hoping to achieve the part of, patients are happy and they have the same feeling as they're going to see a doctor in a physical environment as well.
Right. And another thing to add is something that Doctor on Demand offers very well is that it's flexibility. It has a lot of female physicians, so it's a very positive work environment that would hopefully encourage people to sign on with the company as opposed to offers they get elsewhere. So really, marketing that basically to potential employees and really working with them to hear about what's important to them at a company so that they choose us versus another offer elsewhere, right? Since again, right, having a multilingual provider in the US, definitely high demand for it.
And with multilingual providers, it also reduces the barriers of communication that patients may experience when speaking to someone that does not speak their language. So it would reduce errors for not only the patients, but also the doctors.
And would you guys propose even the same fees to payers to provide these types of bilingual, multilingual services? Would you keep it neutral amongst your patient coverage?
When we look at telehealth right now, as a doctor on demand, I think we cannot offer the service directly. We have to go through the insurance because we discussed this a lot actually. This is like a lot of back and forth between us because we're looking at doctor on demand as an added value support, but then the cost for like an hour can be vary based on language as well. Then we also realized Medicare and Medicaid already offering translation service. Some insurance, I think was Tina also offer translation language. So then there's a conflict as well. So who decided to pay for that as well? And that brings up the question, how do we proceed? So this is when we come in. It has to be a transitional process. We can utilize that resource as well. It's available. Translate our website as well, because remember, when you go to Doctor on Demand, the first thing you see is the website. If you see something in English, you don't understand. But if you can see at least we're focusing on the top 5 languages first, you cannot go into 100% change. If you can read the question, read and understand what's on the website as well, then you can access the care. It's not going to be an easy process to transition, but it's something that I think a lot of companies don't want to deal with because it includes a lot of costs and a lot of challenges. But at the same time, we cannot ignore the large market share that is growing as well. I don't know if any of my coworkers would like to add anything to that as well.
Yeah, as Hamala pointed out, we had a lot of debate about this issue, right? Who would cover translations costs? And we discovered, as she said, that a lot of insurers have a translations hotline. So, there's definitely ways for like a programmer to create a type of direction where you click a button and maybe it helps you facilitate a phone call to your insurance hotline to get in touch with a translator for your visit. But we do think that, based on research and the literature, that having a multilingual provider is really ideal. So we'd want to push for that, but there are definitely ways to mitigate the steps as you move into that rich multilingual base at your company.
One of your targeted groups was those in the rural areas. What are your thoughts on the lack of internet connection or good internet connection and connecting with those people, since that is one of your targeted groups?
It's for the rural areas, one of the options is that not only web-based video visits, but also give patients the option of audio visits. So even if they have no internet, they're still able to connect with doctors on demand using audio only.
Mm-hmm. I will also add to that as well, because with the CARE Act and the Connect Care Pilot Program Act as well, I'm hoping that we will see some upgrade in connectivity, especially with access to equipment and communication. So I'm hoping that somebody go to the rural community to improve internet connectivity as well.
Right. The specific statistic that we found was that the CARES Act that was signed allotted 180 million in funds to support telehealth, and they actually wanted to pay particular attention to infrastructure in rural because it's been a problematic market in the US for healthcare for a long time. There's definitely plenty of literature wanting to reduce that healthcare inequality. So it's the CARES Act kind of created an opening for spending on infrastructure in rural.
Right, and the FCC also has something out there.
Yeah, it's the Connect Care program. They give $1 million.
It definitely isn't going to happen overnight. But being that it was one of your groups, your focus groups, I was just curious to better understand how you plan on focusing on that group. But definitely receiving the phone calls is an option. It is a reduced reimbursement rate, though. Just keep that in mind.
Well, we were also looking at the fact that there's not as many, if you look at the statistics of provider versus patients, there is a lack of healthcare providers overall, right? So this would be another way that we could provide medical care to these patients that are already lacking resources and help. And in the long run, that's cost effective overall even for our country, right? Because anything we do preventative is going to help in the long run.
Mm-hmm. Thank you.
How do you account for patients with cognitive and or physical limitations with use of technology?
As the parent of a chronic care patient, I know that a lot of times when she has visits, and this is we took personal issues that we've dealt with in our lives and looking at this. And so looking at caretakers, building partnerships with the caretakers as well in order to better service those communities.
How many of you have experienced a telehealth visit?
I have.
I have.
Okay, so a few of you.
And do the judges have any other questions?
I do not.
Okay. All right. Okay, Team Glasses, great presentation. Thank you. I'll ask that you stop the share on the presentation. Thank you. Okay, and then now we'll go ahead and have the judges enter into their deliberations, and we will have our last team, Team Vitals Consulting, go ahead and set up.
Thank you.
Thank you so much. Apologize for that delay. I was having a little bit of technical difficulties behind the scenes. So while we wait for the judges, Kenneth, it looks like the judges are still on.
Did the judges not get an invitation to go into the breakout room? Oh, you've deliberated already?
Yeah.
Wow, okay, that was a quick decision. Okay.
I'll hold off on my video then, unless do we have all of the members for Team Vitals Consulting on? Yes, okay. I don't want to delay anything, so I'll go ahead and pass it over to your team to go ahead with your presentation. Thank you.
Who's going to be the lead presenter so I can make you co-host so you can share your screen?
I, Jessica Griff, will be sharing my screen.
Okay, excellent. You are now co-hostess, so you should have an ability to share your screen.
Thank you.
Sure.
Can everyone see it? Great. Jason, take it away.
Great. Hello, my name is Jason, and I'm joined by my colleagues Miriam, Alex, Jessica, and Serena from Vitals Consulting Group. We are here to discuss elevating Doctor on Demand to a new telehealth frontier. This presentation will cover an overview of Doctor on Demand, its current standing in the telehealth marketplace through a SWOT and competitor analysis, and a list of challenges Doctor on Demand faces. We will then discuss various recommendations and financial forecasts based on those suggestions. We will conclude with next steps for Doctor on Demand to fulfill its mission of improving health through compassionate care and innovation. To begin, Doctor on Demand was founded in 2012. Patients could access care 24 hours a day through a phone-based application on a direct-to-consumer basis. With a $40 out-of-pocket fee, Doctor on Demand was able to manage a broad range of conditions, ranging from urgent care and preventative health needs to behavioral health and chronic diseases. However, shortly after, Doctor on Demand underwent a period of immense growth, and with this growth required new leadership. So in 2016, Hill Ferguson was hired as Chief Executive Officer to take Doctor on Demand to this new frontier. And with this transition of leadership, Doctor on Demand pursued a new business model focused less on direct to consumers and more on large health contracts with health plans and large enterprises. And this is known as an employee workforce offering model. Doctor on Demand also needed to make the choice between what revenue model made the most sense, choosing from a visit fee only model, which is the model they had previously utilized, a subscription fee only model paid on a per employee per month basis, or a visit fee and subscription fee hybrid model. They currently operate under a primarily visit fee only business model, in which 95% of their revenue is derived from visit fees and the remaining 5% through subscription fees. Advantages of this model include that its incentives align with the employers and presents a competitive market advantage for Doctor on Demand, because they are one of the only telemedicine companies to employ this model. However, this model is also risky because when there are low utilization levels among employers, they aren't able to capture the revenue from the majority of their subscribers. With this model, we projected Doctor on Demand income statement in the figure on the right.
It's the same as yours. Okay, I'll just put leave, okay?
Using average estimates for revenue, the cost of revenue, and operating expenses estimated as a percent of revenue from Teladoc's annual 10K. And these estimates were utilized to determine the growth effects of Vitals Consulting Group's initiatives. Doctor on Demand currently maintains a competitive position in the telehealth market with an estimated 3% market share. One of their major competitors is Teladoc, who has an estimated 8% market share. However, while sharing a similar business model, Teladoc utilizes a different revenue model, with a majority of their revenue coming from subscription fees rather than visit fees. It is interesting to note that despite these differing revenue models with different employer incentives, Teladoc has a slightly less overall utilization rate than Doctor on Demand and a similar member base. In addition, Doctor on Demand provides a more competitive salary of $2,200 to $220,000 to $260,000 relative to the industry average of $194,000 and slightly less than Teladoc. We performed a SWOT analysis to examine Doctor on Demand's strengths, weaknesses, opportunities, and potential threats. The major strengths we identified were the services offered, the W-2 contracts for physicians that allowed for continuity of care with patients, and the revenue model, which we believe is advantageous for Doctor on Demand after the recent changes in regulations. And we will discuss this further in the presentation. The weaknesses we identified include ineffective methods to encourage utilization and a lack of awareness amongst subscribed employees. In addition, Doctor on Demand does not have an approach in place to penetrate rural markets and is under the restriction of regulatory limitations. Next, we see Doctor on Demand having opportunities for growth based on our research, including the ability to reach untapped patient populations, strategies to promote awareness and utilization of their services, and opportunities for expansion. Lastly, threats for Doctor on Demand include many evolving regulatory and competitive pressures. After analysis of the case, Vital's consulting group identified the major challenges for Doctor on Demand, which we aim to address in our strategy during this presentation. And these include, first, how can Doctor on Demand scale in an evolving regulatory environment? Second, how can Doctor on Demand drive utilization and awareness for their telehealth platform? And lastly, while not specifically identified in the case, we address how Doctor on Demand can reduce disparities in telehealth. And each of these challenges are non-specific to Doctor on Demand, but rather they represent challenges for the telehealth industry as a whole, and we see them as all interrelated. So we are excited to share some of the evidence-based strategies Vital's consulting group has developed to navigate these industry challenges. And now I'm going to pass it off to Miriam, who will describe how Doctor on Demand will tackle scaling.
Thank you, Jason. Prior to the COVID-19 pandemic, telehealth services were limited by Medicare, Medicaid, and private insurance company reimbursements and restrictive regulations. In light of an evolving regulatory environment post-pandemic, Doctor on Demand must decide which providers to add, which services to offer, and whether or not to expand these services to insured patients. In response to the COVID-19 pandemic, the Centers for Medicare and Medicaid Services made several key changes to coverage restrictions that address payment and service parity. These policy changes include waiving out-of-pocket costs for telemedicine visits, expanding services beyond general medical and behavioral health visits, including reimbursements for non-video visits and virtual check-ins, and allowing providers to meet with new and existing patients regardless of their geographical location. These changes allow Doctor on Demand to expand its base of providers, patients, and available services in the wake of a rapidly evolving regulatory environment. Based on these regulatory changes, we recommend that Doctor on Demand expand to accept patients covered by Medicare Advantage Part B and increase the number of private payer partners. Based on Doctor on Demand's current market share and utilization rate, we estimate an additional gross profit of $62.2 million and an increased pool of 7.4 million patients over the next 5 years. This recommendation is highly probable considering Doctor on Demand's increased utilization rates within the 65 and older population during the COVID-19 pandemic. In addition, incorporating insurance reimbursements fits well with our current fee-for-service business model. We therefore do not recommend switching to the majority subscription-based platform utilized by your competitors. Now that the majority of mental health services are covered by Medicare and reimbursed at the same rate as in-person services, Vital's consulting group recommends increasing Doctor on Demand's base of mental health professionals and available services. Recent data shows that the average share of adults reporting symptoms of anxiety and/or depressive disorder has skyrocketed from 11% in early 2019 to over 40% in January 2021. In addition, nearly 6.5 million patients living in rural America are currently suffering from untreated mental health disorders with severely limited access to care. The United States map on the right points to specific geographical locations experiencing mental health professional shortages as of January 2021. Under the educated assumption that the majority of states will continue to allow the delivery of telehealth services across state lines, we recommend that Doctor on Demand allocate a significant sum of its marketing and sales budget towards targeting rural populations in desperate need of mental health care. These streamlined marketing strategies and expansions are expected to increase Doctor on Demand's base by 132,000 patients with higher than average rates of utilization, thereby increasing year one gross profits by $22.1 million. In addition, access to maternal health services is severely limited throughout rural America, as demonstrated by the strikingly similar geographical distribution shown to the right of the screen. Notably, several studies have demonstrated telehealth's untapped potential to deliver a wide range of medical services both during and after the prenatal period. Vital's consulting group therefore recommends that Doctor on Demand expand maternal health services specifically within rural communities, thereby drastically increasing access, opportunity, and revenue in light of the new Medicare physician fee schedule. A strategic marketing and advertising campaign in combination with a robust virtual check-in schedule is projected to increase Doctor on Demand's patient base by more than 550,000 pregnant people with higher than average utilization, thereby increasing year one gross profits by at least $1.1 million. Jess will now discuss our plans to reach an untapped patient population, expand specialty-specific services, and develop a user-friendly e-check-in platform.
Thank you, Miriam. Additionally, Vital's consulting group has identified rare disorders as a new frontier of telemedicine. A recent study conducted by the National Organization of Rare Disorders found that 88% of rare disorder patients and caregivers accepted a telehealth visit when afforded the opportunity. Of those utilized telehealth services, 92% reported a positive experience and 70% demonstrated their interest in future telehealth appointments. We therefore recommend that Doctor on Demand explore potential high-profile partnerships with advocacy groups, such as the National Organization for Rare Disorders, to become the national telehealth leader in providing much-needed services to a previously untapped patient population. These strategic partnerships are projected to immediately increase the patient base by 25 million and year one gross profits by 8.7 million. Research of telehealth visits within various specialties shows that psychiatry has the highest percentage utilization of telehealth, followed by GI, endocrine, neuro, pain management, and primary care, where specialties like ophthalmology is one of the least. There is clear overlap between specialties that use telemedicine the most and specialties that manage chronic illnesses. In addition to focusing on mental health services for rural populations like Miriam had mentioned, we recommend increasing those services for all patients, as well as focus on management of chronic diseases, as these areas of medicine have recognized the benefits of telehealth already. With the evidence-based expansion of services, we recommend increasing the nurse practitioner to doctor ratio to cater to the projected increase in demand of services. There are 3 reasons for this suggestion. 1, a national physician shortage has made increasing the number of physicians infeasible. 2, nurse practitioners of those with equivalent qualifications are cost effective. And 3, a review of patient satisfaction demonstrated comparable satisfaction for nurse practitioners for low acuity care. Now, how many times have you wanted to ask your physician a medical question but did not think your issue warranted a formal trip to the doctor? Or have you ever tried looking up your symptoms on the internet searching for a diagnosis? Our assumption is absolutely. We therefore recommend offering a service known as e-check-ins. Surveys of patients' use of telehealth have shown that the majority of patients have used some sort of modality of telehealth, but other than video conferencing, which only accounts for 5% of total interactions with telehealth. This trend indicates that there are patients who'd be willing to use Doctor on Demand if they were offered the communication platform of their choice, mostly something like patient portals or emails. With a government push towards greater access of care, as of 2019, CMS reimburses this type of service, allowing for the remote, asynchronous evaluation of patients at around $12 per check-in. In our comparison of sample schedules, we highlight that the inclusion of e-check-ins will increase physician efficiency while aligning with patient preferences for how they wish to interact with virtual services. Here, we demonstrate the ease and practicality of an e-check-in. On the Doctor on Demand app, you'll be able to select e-check-in right from the home screen. Type in your question and any related symptoms, and you can even include a picture or video. Within 24 hours, you will receive a notification and can now access the response to your question with the option to follow up with a provider through Doctor on Demand if necessary. I will now hand it over to Alex, who will outline how Doctor on Demand will increase awareness and utilization.
Thank you, Jess. Doctor on Demand's largest utilization threat is the fact that users are uneducated and unaware about their access to telehealth services, do not know how to incorporate these services into their current healthcare, and are unsure of why they should. Industry standard demonstrates that 62% of those surveyed are unaware of whether telehealth services were even included on their health plans. Although utilization rates vary across Doctor on Demand's customers, the average is low at 10%. To tackle this, we are proposing the implementation of a loyalty program paired with an advertising and marketing approach that incorporates employee education, awareness, and medical care interest. Loyalty programs have been repeatedly shown to increase consumer utilization, drive significant value, and be critical for growth. I mean, come on, who doesn't love free stuff? The program we propose has minimal cost. Customers will be categorized into 3 tiers of loyalty: silver, gold, and platinum, based on the utilization rates, and will be offered discounts accordingly. For example, for a customer to be considered silver, they must reach 20% utilization and will earn a 6% discount. Modeling our program off of Accor hotels and using conservative predictions, we project to increase our gross profit by $59 million over the first 2 years, increasing utilization by 9.6% over 5 years. We aim for an expansion of our loyalty program by having a phased goal of 7.7% adoption of our subscribers in the first year and 15.5% in the second, followed by a 1% increase in utilization attributed to our awareness program during the 3 subsequent years. With Doctor on Demand's current customer satisfaction rating of 4.9 out of 5 stars across the iTunes Store and Google Play, we are confident about piloting this program and will monitor its success via analyzing our utilization across customers and seeing its impact on Doctor on Demand's Net Promoter Score. However, we understand that our plan to provide incentives would be futile without a strategy to raise awareness, which brings us to the next phase of our strategy. In addition to the implementation of a loyalty program, we also propose the introduction of employee education marketing emails that incorporate the use of a survey. Use of these types of emails are successful, savvy, and an evidence-based advertising and marketing approach. The overall process works in the following way. Firstly, increase communication to employees through email. Secondly, incorporate a link to an artificially intelligent algorithm-based survey inspired by the qualitative survey model that collects data on specific medical service interests and needs. Thirdly, provide future email correspondences that include cost and convenience benefits associated with services that patients indicated are of interest to them. Overall, email communications will include only education and awareness about medical topics, providers, and services indicated of interest and need to patients, including cost and convenience benefits, which will make communications more meaningful, relevant, and targeted. This marketing and advertising approach is crucial to increasing Doctor on Demand utilization and maximizing its ROI, indicating a minimal cost for a large benefit. I'll now pass it on to Serena, who's going to speak to you about telemedicine disparities.
Thank you, Alex. Now we will address disparities in telemedicine. Regarding disparities in the delivery of telehealth services, Black and Latinx patients use video during telehealth visits significantly less frequently than their white counterparts, a finding consistent with the cultural differences and the fact that minority groups are less likely to own a computer or have reliable cell phone coverage and broadband. Unfortunately, the financial burden of COVID-19 on the disproportionate number of minority patients in low-paying essential jobs has already been shown to worsen these pre-existing digital disparities. We therefore recommend that Doctor on Demand allocate 3% of its annual gross revenue towards charitable and culturally sensitive telehealth services for Medicaid, uninsured, and underrepresented minority populations who otherwise would not have access. We recognize that a large portion of medically underserved populations do not have access to stable broadband internet. So we would therefore recommend partnering with internet providers who already have specials for low-income individuals to increase access. Engaging in corporate social responsibility is in line with the Doctor on Demand's mission to provide compassionate and innovative care. And these efforts have recognized benefits beyond a positive impact on the community, such as increasing customer loyalty, maintaining a positive reputation, receiving financial benefits, and outshining its competitors. So to put everything together, within 1 year, we assume expansion to Medicare Part B and an increase in privately insured patients using our services, as well as 7.7% of the loyalty program initiated and a 15.5% adoption of the program by year 2. Rural and rare disease initiatives are planned to be phased over the first 3 years and contribute to linear growth over this time period. We project a revenue increase of approximately $620 million over a 5-year period, with most of the growth expected in the first 4 years after implementation of recommendations. To summarize, we address scaling in a changing regulatory environment through expansion to Medicare Part B and privately insured patients, better cater to the healthcare needs of rural America, focus on specialties with high utilization rates of telemedicine, increase the nurse practitioner to physician ratio, and introduce e-check-ins. The formation of a loyalty program and employee education emails and survey will increase awareness and subsequent utilization of doctor on demand services. We suggest continuously monitoring regulatory changes regarding provider licensure, the ability to practice across state lines, telehealth reimbursement expansions, and doctor on demand's competitive advantage. Also, we recognize reassessing the Net Promoter Score at given time intervals to realize the impact of our strategies. These are our references, and we have included our financial workbooks in an appendix. Thank you so much for listening to Vital Consulting Group's presentation, and a special thank you goes to our wonderful advisor, Bookie. At this time, we are open to questions about the innovative solutions we recommended to elevate Doctor on Demand to a new frontier.
Great, thank you, Team Vital's Consulting Group. Excellent presentation. I'll now go ahead and pass it over to the judges for a question and answer session.
I'd like to start and say that you did a fantastic job presenting the data. So congratulations on that. And thank you for the information. Thinking about the loyalty program, if you're focusing on Medicare, Medicaid patients, the goal of those managed care companies is to reduce costs, which may mean reducing the amount of visits. So when you're looking at a loyalty program, if I remember correctly, their incentive was the more you utilize the application, the more you get as a discount. So is that in reality geared towards cash pay patients, or is there a different incentive program or loyalty program for the managed care companies?
Sure, great question, thank you. So we definitely thought a lot about this, and we wanted to address the issue of possible overutilization or just overuse. And so we understood that a lot of course, insurance companies use copays. And so what we wanted to do here essentially was regularly review overutilization data and adjust our loyalty program accordingly. And at the same time, kind of identify and utilize evidence-based best practices and protocols and guidelines for diagnosis, for treatment and care, and then use this information to educate patients about an appropriate use of televisits. And so it's more so, I think it's appropriate for both patients. It's more so not trying to get patients to overutilize these services, about educating them and having them use telehealth rather than going to a physician in person.
And I'm just going to add a little bit to what my colleague Alex said about that. Also, you know, the use of the email program that has the survey in it is also going to help with that possible overutilization or wrong utilization, where the survey is going to collect data on what type of services our patients are interested in, what they need, what type of pre-existing medical conditions they have. So hopefully what Doctor on Demand can do is actually anticipate overutilization and correct it and implement strategies to it with regarding which specialties or which services might be at risk for it in advance.
I was curious in some of your research and exploring the rare disease advocacy groups, you would think that these particular conditions lend itself to telehealth services just by virtue of how few specialists there are around the country that can actually consult patients for these conditions. Did you find that this is sort of already existing, or is this truly an untapped market?
I can help answer this question. Thank you so much, Dr. Mishkin, for that question. Our research actually indicated that this is truly an untapped patient population and that the rare disease patient population has limited or no access to telehealth services at this time, particularly because specialists don't offer their services over a telehealth platform. A recent study conducted by the National Organization for Rare Disorders, which we plan on partnering with, indicated that 90% of patients, when offered the opportunity to receive a telehealth visit, accepted that, and 78% of those patients were happy with their telehealth visit. So currently, the market research shows that this is an untapped patient population. By partnering with NORD, this elevates Doctor on Demand to a new frontier ahead of its competition, which currently doesn't offer these services to patients with rare disorders.
You mentioned recruitment of nurse practitioners to address the issue of physician shortage. For patients with multiple comorbidities and more complex care, in an attempt to reduce hospital utilization costs, how do you address incentivizing physicians to care for those patients?
Yeah, thank you so much for your question. I would say our approach to including nurse practitioners was threefold, focusing on we would love to attract as many physicians as possible, but believe that is infeasible because what you mentioned of the physician shortage. And believe that these nurse practitioners fit well in areas of low acuity issues. So for patients that do have more complex cases, we still have plenty of physicians on staff, and we will continue recommending the W-2 contracts so that they are full-time employees, not contracted, subcontracted out to care for these chronic illnesses and comorbidity patients.
One of your slides shared that the restrictions have been lifted and many of the patients you wanted to focus on were in the mental health space. What is your plan when the regulations change again and not all of the codes and not all of the procedures can be done through telehealth? How is your business model going to change?
Thank you for that question. I can also help answer that. So we don't anticipate that all of the regulatory changes that were made because of the pandemic will be reverted in the immediate future, partly because several high-power organizations are currently lobbying in Washington, D.C. for these regulations to become permanent, which would allow for many of these to continue to be provided over telehealth. But that's an excellent point, and we've taken into consideration that our mental health services that we're targeting towards rural America will focus on depressive and anxiety disorders, which we expect to continue into the near future, as well as drug abuse disorders, which also we expect, based on the literature and research, to continue in the near future. So we've accounted for specialty-specific services that we don't anticipate changing post-COVID regulatory environment.
Thank you.
Do our judges have any other questions?
Really good job, guys. Excellent.
Okay, great. All right, thank you, Team Vitals Consulting. You can go ahead and stop the share, thank you. At this time, our judges are going to move over into our breakout room for deliberations, and then we will go ahead and have our program close. Okay, so while the judges are in their deliberation, I just wanted to take some time to recognize our healthcare heroes. ACHE of South Florida has always been focused on supporting our members, and that mission did not change during the pandemic. In 2020, ACHE of South Florida offered eligible members 2 financial award programs, one to recognize those going above and beyond, the other to help those who might be struggling during these troubling times. Now, ACHE of South Florida presented the Healthcare Hero Award in November to 2 deserving members. The awardees included Giselle Fernandez, who is an ICU registered nurse at Mount Sinai Medical Center, and Timothy Curtin, who is a behavioral health administrator with Memorial Healthcare Systems Community Service Department. So at this time, I'd just like to share a video that's a nod to all of the efforts that our healthcare heroes have done.
"2020, a year that will define us for decades to come."
Heightened states of emergency across the nation as the number of coronavirus cases soars above 3,000.
COVID-19 hit our shores in January and blazed like wildfire across the country. Coronavirus is now considered a global health emergency. It devastated communities, families, and our industry, and left many feeling frightened and alone.
Many medical professionals on the front lines compare the conditions that they face to what it's like in war zones.
But caregivers stepped up. You reminded us that we are all stronger together. Together, you redesigned care in real time, innovating solutions to difficult problems as the pandemic evolved. You remained focused on the mission, providing the best care possible to patients who are often isolated from loved ones. And your focus and commitment transformed their care. You came together as teams, supporting each other through supply shortages, overwhelming demand, and through the devastating loss of colleagues. Too many caregivers paid the ultimate price, and we are forever in their debt. All of you did amazing things, and the world recognized you as the heroes you are. You lifted your communities, and in turn, your communities lifted you.
Oh, that's awesome. Look at the board. The entire Red Sox team is saying thank you.
Thank you to our healthcare heroes for your unwavering commitment to transforming care and the lives of patients, their families, and each other.
So again, we'd like to thank our healthcare heroes, and I also want to give a nod to Press Ganey. That was actually one of their videos, and they have been a proud sponsor of ACHE of South Florida through the years. So it does look as if our judges are back from deliberations. So at this point, we'll go ahead and move into our program end. I'd like to introduce Oyinkansola Buki Ogunrinde. Everyone knows her as Buki, our ACHE of South Florida 2021 president-elect. She's also wearing another hat as well as membership chair, doing a lot, or superhero. Buki has provided numerous years of service to ACHE of South Florida. She served in the capacity of membership chair, student service chair for 2 terms, sponsorship chair, and has also received both the Regent and Service Award. So Buki, I'll go ahead and pass it over to you.
Thank you, Ayana. Appreciate that. Please, may I share my screen? That's okay. All right. Can everyone see the PowerPoint that says congratulations? All right, so congratulations. It's my pleasure to announce that the 2021 ACHE of South Florida chapter Healthcare Leadership Development Case Competition has concluded. So you all can take a deep breath, put those smiles back on your face. We really appreciate it. Thank you so much. It's really been a pleasure to listen to all of you. And while I'm very envious of everyone today, I am not envious of our judges at all. Because you all gave such a beautiful presentation. Good luck to them making that decision. So thank you all so much. Really appreciate it. Was blown away by your performances. As you return to your post-case competition live, and of course, after catching up on the loss of sleep, which I'm sure you experienced for the past couple of days, I do want to implore you to reflect on your experience. I want you to think about the skills that you've acquired, whether it's learning to work with others, in a team, teamwork, flexibility, resourcefulness, learning to present, conducting research, and of course, just juggling all the balls that you typically have in the air as students. Also, when you think about the relationships that you forged, they will certainly add to your network, but also they could lead to friendships or even mentorships. And in my opinion, that's actually the greatest gift from doing this kind of exercise. So please cherish all of them. I do want to mention that actually as an example, speaking of network, ACHE of South Florida chapter actually offers a number of scholarships. And while we do get that information out to all of our student body, we also do ping, our case competition folks just to let them know that, hey, there's a scholarship out there. So one, I do want to mention that we do provide scholarship to our students, and we hope that you become members so that you can partake in applying for those, but also in terms of networking, being a part of this type of events, and certainly part of ACHE and our chapter will lend you to them. Last, I just want to talk about the overall growth that you may have experienced. And I think you probably did. Growth is exactly what you get when hard work and perseverance, comes together. And I'm very sure you certainly experienced those two things this time around. So for some of you, the growth will be very evident. And for some of you, it will just gradually show up. But I can assure you that you will experience this growth, and it will carry over to both your personal and professional relationships. So again, congratulations to all of you. I do want to take the last few minutes to thank all of our audience, the fellow students, the faculty members, program advisors, family, friends, and all the professionals. Thank you so much for taking time out of your Saturday to join us and witness the hard work and the great work that the students have put together. To our judges, Dr. Thompson, Dr. Mishkin, excuse me, and forgive me for mispronouncing that. And of course, Mr. Manzi, I really, really do appreciate your efforts, your time, the objectivity and fairness we know that you brought to the process, and of course, your expertise. Thank you so much. To our board members who were able to join us today, Ralph, I see Kenneth, of course, Mala, Adrian, Ayana, of course, and a couple of others, really do thank you again for taking the time out of your weekend to spend it with us. And of course, to our Student Services Committee, and our chair-elect, Mala, I do want to say a special thank you for all the hard work that you've done that has accumulated in today's program. I do also want to give a special thanks to Adrian Parker, who has really done an incredible job. All the videos that you enjoyed during the break, he pulled all of that together. And of course, to those who were featured in those videos, they did put in the time to record their message to you. And we do thank them all. So again, thank you so much, Adrian. And of course, the incredible work that you're doing on our LinkedIn platform. Appreciate that. Please make sure that you do connect with us so that you may enjoy them too. And I want to thank our president. His support, unrelenting, his fearless leadership, definitely palpable, and you see that throughout today's presentations. Thank you so much, Kenneth Wong. I'm really proud to be coming after you. I hope I can fill those shoes. Mine will be stilettos, but I'll give it a shot. So thank you again so much for your leadership. It's truly inspiring. And of course, special thanks to the last but not certainly the least person who has really worked so hard to make today happen. Her diligence, hard work, organizational, strategic, and operational skills all came together to see what you witnessed today and to bring this to a very successful fruition. Ayana Mila, the 2021 Chair of the Student Services Committee, thank you, and you deserve a round of applause. Thank you so much. Thank you. This is truly incredible. So to that end, I will turn it back to you. And again, thank you, everyone.
Thank you so much, Buki. I really have nothing left to add to that. I just want to thank all of the teams for all of the hard work. I know that you guys are juggling, private time and school and everything, and that you've taken that time, to participate in our case competition. We really do appreciate that. I see that Kenneth has the poll up here. Okay, if you guys can answer that question. We're actually wanting to schedule the award ceremony for Tuesday, April the 27th, and just trying to gauge everybody's availability as to whether we would do a lunchtime or evening. And it looks by the poll that everybody is more available during the evening time. So we will definitely be sending out more information regarding the award ceremony within the next week or so. I want to again thank our judges. We really do appreciate you all participating in our event. and taking time out of your busy schedules, and of course on a Saturday at all. So we really appreciate you guys taking your time. To the committee, the Student Service Committee, yes. Thank you guys for all of your efforts. This really could not have been a success without all of your help and all of your knowledge. So I really do appreciate that. So at this point, we will go ahead and close our 2021 case competition. Thank you again, and you guys have a wonderful Saturday.